I see. So he has to be listed as a deputant. Right. And the
Or
gentleman
an
who's standing.
invited presentation, Joe Hester, the executive director of the National Health Community.
Yes, yes.
Also named himself.
So he's going to present as well.
Well,
so should they go first?
They should go first, yes. So I don't know.
So what
Let me
are
just
their
see if
names?
there's. No, Sam. I'm just sure I've forgotten his last name. He's Joe Hester. Let me just check quickly on what their expectation. I thought Sam was the main presenter. But I'm not sure why the names aren't there, but essentially, Sam, Joe, Helen, Chiefs in Toronto Central, she's our partner.
They're doing the presentation.
I think they're all involved in the presentation, all three of them.
So you're not doing the presentation.
No, not mine. So is everything set? I just wanted to make sure the chair knew what the order. So Sam, Ellen, and Joe are all kind of part of the presentation. And you're clicking.
Officially clicking.
Remind me, what's Sam's surname? Perfect. Okay, good. I knew it had to be somewhere.
Run me through those processes.
You guys are just going over the pronunciation stuff?
Yes.
Okay.
Okay, they're ready to go whenever we call on them. Oh, good save. Good save. Lightning fast reactions from years of political acuity. I seem to be. They're leaving me out of all the distribution.
Doctor, how are you?
1, 2, 3, 4, 5, 6. What's quorum? 7?
Should be 7, yeah, that's the majority.
Okay. So we'll get started, ladies and gentlemen. Hello, everyone.
Doesn't sound like you're turned on.
Test, test.
Pretty full house.
Good afternoon, everyone. We'll get started with our Board of Health agenda. Yes, we do. It's in the room, but it's not seated. Francis sits. Thank you very much, everyone. Welcome to the 12th meeting of the Board of Health. For those with us in the room, the screen at the back of the room provides real-time updates concerning where we are in the agenda and what is coming next. You can follow the agenda and debate on your computer as well at www.toronto.ca/council. The Board of Health also gratefully acknowledges in its meeting that it is meeting on the traditional territory of the Mississaugas, of the Nucredit First Nation, the Anishinaabe, the Haudenosaunee, and the Wendat, and home to many diverse Indigenous people. Are there any declarations of interest pursuant to the Municipal Conflict of Interest Act? Seeing none, I'll ask for someone to move a motion to confirm the minutes of the meeting from April 25th. Moved by Peter. All in favor? Opposed to any? That's carried. What we usually do, folks, I see a lot of new faces here. We go through the agenda, call it rapidly, to see what items are held and which items we can move just the recommendations of staff. If there are any presentations or deputations, then we hold the item, of course, because someone wants to speak to it. So we'll go through it fairly quickly, and then we go back and start from the beginning again. So our first item of business, 12.1, is the Toronto Indigenous Health Strategy. We have a presentation and we have deputations, so we will hold on that. 12.2, legalization and regulation of non-medical cannabis. We have deputations on that, so we'll hold that. 12.3 is Chemtrack, pollution prevention partnerships. We'll hold that because we have a variety of deputants there. 12.4 is the Toronto Public Health response to Syrian refugee health needs. Update. Are there any holds? There are no deputants, so we can pass through this.
I'll move receipt.
Move receipt with a great deal of thanks. Is there anyone here from the newcomer office just on this? Okay, well, in addition to the newcomer office and in addition to Dr. Hazel, you folks did a fantastic job on our part in the Syrian refugee settlement of the GAR, so the Government Assisted Refugee, and Toronto is in your debt. So thank you very much for that. And with that, we'll take a vote on that item, which is receipt for information. All in favor, opposed to any, that's carried. 12.5, recruitment and selection of medical officer of health. That's here for your information. So move the recommendation, which is to receive this for information. All in favor, opposed if any, that's carried. 12.6, we have a deputant, so we'll hold that. And the issue there is the introduction and enactment of bills to govern proceedings of the Board of Health of the City of Toronto Health Unit. 12.7, the Toronto Public Health operating budget variance for 3 months ending March 31st, 2016. We have also a deputant for that, so we'll hold that. 12.8 is Toronto Public Health capital budget variance report for the 3 months ending March 31st, 2016. Excuse me, once again, we have a deputation there, so we'll hold that for a dep. 12.9, service agreements awarded and executed by the Medical Officer of Health for 2016, the standard annual report. There's a speaker for that as well, so we'll hold that. And then there's one item left, and that's 12.10, the Toronto Urban Health 2016 Fund allocations and review process. It did not come out right away, but it is part of your supplemental on cover with a yellow cover. Is there anyone holding that? Anyone willing to move the recommendations? Thank you. Maybe you can say thank you, because they deserve a lot of, some
want-
people did a lot of work on this.
I want to say thank you on the item 10 because a lot of work goes into processing, and maybe isn't the right word, all the people who are applying for funding. It's not easy because we never have enough funding of groups we'd like to support. So I do want to thank everyone who applied as well. And, please keep coming back. We've got some amazing programs here, and this is what makes our city so wonderful. So thank you to everybody who was involved in this.
Okay, are we okay with accepting the recommendations of staff for the allocations? All in favor, opposed if any, that's carried. That takes us to the end of the quickly going through part of the agenda. We'll now go back to the top of the agenda and deal with the items that have been held or are here with deputations. So our first item, proudly so, is the Toronto Indigenous Health Strategy. And to help us with that, we have a presentation of the group that has put together this. Toronto Public Health has been a part of it, but it hasn't been the lead in it. And so I'd like to welcome three people here who have been instrumental in putting this together. Sam Cloistra, who is with the TIHAC Youth Council Coordinator. Joe Hester, who's been here before, the Executive Director of Anishinaabe Health Toronto, and an advisor to the larger process, excuse me. And Ellen Blaze, Aboriginal Health Consultant and Communications Lead with the Toronto Central Local Health Integration Network. Welcome, and so it's up to you to present, and then we might have questions, and of course there's some deputations as well. But first and foremost, welcome.
Thank you. I'll start off with a quick introduction. Ani Buishigawan Makwa and Deshnakas, Matawagaming and Donjiba, Takaranto, Ward 29 in Donji, Wabijashi Nadoram. Hi everybody, my name is Sam Kludstra. I'm from Outagamie First Nation in Northern Ontario. I live here in Toronto on the Danforth, Ward 29, and I am Martin Clan. I'm the youth coordinator for the Toronto Indigenous Health Advisory Circle, and I'm here today to go through the Toronto's Indigenous Health Strategy, and it's the first one in the city, and possibly the greatest one in the world. Just gonna say. Okay, so I'll just get right into it then. In 2009, Toronto Public Health and Toronto Central LHIN began combining their Indigenous health engagement efforts to reduce duplication and increase system integration. So we recognize that this strategic plan is not the end of planning for Toronto, but an exciting beginning. As this is a 5-year strategic plan, there will be another one coming up in 2021. The community voice has shaped this plan. We have drawn extensively from the words and ideas of over 200 members of the community. So this is including Two-Spirit population, LGBTQ, the Indigenous community as a whole, elders, youth, men and women. And it's really to craft this integral part to our community's health and well-being. So on your slide right now is a picture of the poster that we used to promote the launch of the THAC at the Native Canadian Centre in January of last year. So the mandate that we follow is made up of 2 parts. The first is to guide and advise Toronto Central LHIN and Toronto Public Health in their in their health programs and services for Indigenous people. And the second is to influence the policies which impact the health of Indigenous peoples in this city. So in order to fulfill part of this mandate, the THAC developed the Indigenous Health Strategy. So this is, again, a 5-year plan, and we're presenting it to you today as a final product of just a collection of all of the knowledge and experiences of our community that have gone into it. So we're asking that Toronto Public Health and Toronto Central LHIN put these ideas and this strategy to action wherever they deem appropriate. So in the center of this image is actually a logo that we created for the THAC. And so the logo was designed by Joseph Sagaj and Holly Fisher, and we worked with an elder in the Indigenous community, Diane Longboat. It's infused with meaning and is based on the traditional star blanket quilt. Each point of the star represents one of the 8 advisors who sits on the THAC. And although the advisors are leaders of Indigenous organizations in the city, they come really representing themselves as individuals with their own experiences and ideas. So starting in the east, we have Sarah Wolf and Sarah Medanik. In the south, we have Ken Richard and 2 youth council representatives. In the west, we have Larry Frost and Joe Hester. And in the north, we have Dr. Janet Smiley and 2 reps from the Elders Council. So here's a look of our complementary mandate. We want to meet the health needs of Toronto's diverse Indigenous community. So the original partnership that brought the THAC together was Toronto Central Lynn, Anishinaabe Health, and Toronto Public Health. TPH and TC Lynn are sponsor organizations of the circle and work with partnerships with the advisors. So this is really a very good example of what a nation-to-nation partnership looks like. The leadership of both Toronto Public Health and Toronto Central Lynn attend every meeting of the circle, and this has been tremendously important to relationship building within our community, within the Indigenous community. So while Stats Canada says there are only about 19,000 Aboriginal people in Toronto, our Health Counts Toronto found that there are actually between 34,000 to 69,000 diverse Indigenous people living in this city. So to visualize that, that's about the population, roughly give or take a few tens of thousands of the city of Timmins, basically. Our Health Counts also found that there's a discrepancy around income. So while Stats Canada says that 26% of the Indigenous population live below the low-income cutoff, our Health Counts actually found that 90% live below the low-income cutoff. So that's less than $20,000 per year before taxes that we have families living off of. Our Health Counts notes that there is lower participation in the National Household Survey because low-income Indigenous people more frequently and more likely move or are to be homeless, and therefore do not receive mail consistently. Also, those Indigenous people who did participate in the Our Health Count survey may have higher income and thus more free time to actually participate and volunteer their time. So we want to thank Our Health Counts and 7 Generations Midwives of Toronto for releasing this preliminary data for us because it paints a much richer picture of the Indigenous community in Toronto, and it's actually very eye-opening. So the council is actually made up of a few parts. One of the most important parts is the Youth Council. So the Toronto Indigenous Health Advisory Circle Youth Council is made up of 7 youth who have come forward and been elected by our Indigenous community of youth. So I'm actually the coordinator for this council. It's my baby, and I love all of these youth that participate because they bring with them their emotions, their knowledge, their experiences, and they know what they want to see, but they just need somebody to listen. So the Youth Council brings this diverse health needs of young Indigenous people in the city while providing innovative solutions. So our Youth Council is actually very active and engaged in the work of THAC and also in the work of the Indigenous community. So the THAC Youth Council is actually hoping to host an Indigenous Youth Health Forum in the upcoming year, where we're going to ask our youth in the city what they want to see for their health and what health and well-being means to them. So the Youth Council actually represented THAC here in City Hall for the Aboriginal Affairs Committee, as well as during the Budget Committee. The second integral part of the THAC is actually our Elders Council. So the Elders Council provides direction and support to the THAC and created an ethical code for the advisors to guide how they work with one another. This code is based on Anishinaabe, Haudenosaunee, and Mi'kmaq teachings, and there are 4 elders who provide us guidance. So there's Diane Longboat, Cindy White, Amy Desjardins, and Clayton Shirt. And so you can see that the Youth Council and the Elders Council will actually work together to provide accountability for our THAC, as well as the diverse experiences that both of those groups bring. So our vision, we envision a thriving and healthy Indigenous community in Toronto through the respectful harmonizing of practices, policies, and resource allocation. Our mission, to lead transformation in health programs and services toward well-being for Indigenous people in Toronto. And our operating principles. We want Indigenous peoples as full partners. So health plans are developed with Indigenous peoples on a nation-to-nation, community-to-community, individual-to-individual level. We don't want a paternal relationship anymore because that's obviously not working. Number 2, we want culturally appropriate, safe, and proficient care. Wherever Indigenous peoples go to access programs and services, they receive culturally appropriate, safe, and proficient care, and all barriers to optimal care have been removed. We're We're not going after cultural competency anymore. We're going after cultural proficiency. So number three, high quality care based on community needs. Care is planned to be responsive to community and its needs and is appropriate, efficient, effective, and high quality at both the systems and the interpersonal levels. Number 4, collaborative system with dedicated resources and funding. Dedicated resources and funding for Indigenous health programs and services will support a coordinative and collaborative system. Number 5, we want to increase Indigenous leadership and care capacity. So leverage and build the capacity of the Indigenous community, the leadership, the youth, the elders, so that we have the capacity to care for ourselves. One of the greatest quotes in this strategy is actually Indigenous health in Indigenous hands, and that sets the tone for what this is. So this is an example of the governance structure that we follow. It's actually a very Indigenous concept in that it's nonlinear. And this is actually hard for some people to grasp because it's not a linear structure. So this is the health planning model that drove our work. I'll take you through each component basically. So starting with the outer ring of our wheel are the overarching themes, which inspired the rest of the strategic plans. These themes are the reclamation of well-being, the spirit of reconciliation, and the importance of reinforcing a needs-based population approach. The next ring of our wheel propels us towards action. These are the 3 strategic directions that are in this health strategy. The first one, to reduce health inequities for Indigenous people. The second one is about influencing systems that impact the health of Indigenous people in Toronto. And the third strategic direction focuses on harmonizing mainstream biomedical and Indigenous health programs and services. So this direction is about closing the institutional care gap that currently exists. So many thanks to Dr. Bernice Downey, who helped us conceptualize this very amazing framework. So I'll go through strategic direction number 1 with you. So we have created 7 recommendations under this heading, and they're expanded upon in the strategic plan itself. So we want better integration between the mainstream health systems and Indigenous organizations through better referral systems leading to increased access to primary care and mental health services. Number 2, increase Indigenous cultural safety training for all people who work in the healthcare system in Toronto. This will include public health, community health centers, hospitals, and long-term care facilities, to just name a few. And 3, we want to develop a 1-800 healing and caring telephone line and knowledge hub. For example, people who are coming into Toronto from northern communities for healthcare, or even people who live in Toronto and do not know how to access the health system, will be able to call in and find easy-to-access information on Indigenous health. So I've seen this model before in New York City with the American Indian Community House, and it's a very successful way of getting a community who's often mobile interested in their own health, and also gives them access. It creates an accessibility that this community can now have. So number 4, we want to fund more Indigenous system navigators into the existing system. We would like to see at least 1 employee at each organization dedicated to being a culturally safe navigator for Indigenous clients and patients. 5, ensure that healthcare spaces are welcoming and accessible, inclusive of Indigenous people. This might include a place in a hospital for you to practice a smudge ceremony, or a safe space where you can practice culture. We want to increase funding for culturally safe primary care for people who have chronic diseases such as heart disease and diabetes. And 7, we want to create and support existing programs for seniors and families impacted by residential schools. Big news today, Premier Wynne just came out with an apology for the residential school system, actually at Queen's Park. I was there this morning. I was actually tearing up because it's such an important step in reconciliation. But I will say one thing, this strategic plan came out last week, so we're a little ahead of the game. And I think that's so important because it shows that Toronto is actually driving the way for reconciliation with Indigenous peoples. And I think it's up to the city to keep that momentum going. So I'll go through strategic direction number 2 now, which is to influence the social determinants of health. So there are a number of systems that we recognize need attention in order for the Indigenous community to heal and have better health outcomes. They are housing, food, education, justice, child welfare, and human rights. So within the housing system, there is a need for racism from landlords to be addressed. Number 2, a need for housing for youth, seniors, two-spirited and trans Indigenous youth, and pregnant Indigenous women, especially those whose lives are affected and impacted by the child welfare system. 3, within the food systems, advocating for healthy food for Indigenous people in Toronto, including gardens that are accessible. And this isn't just something that would benefit Indigenous people, this would benefit the entire community. 4, within the education system, we would like to see advocacy for a greater number of Indigenous teachers, cultural opportunities for teachers to learn more, and for students to learn more. 5, within the education system, again, we want to advocate for additional Indigenous-specific adult learning centers and a preparatory school that bridges the finishing high school with preparation for success in post-secondary, whether that's at university or college. 6, within the justice system, we would like to advocate for culturally appropriate court processes for Indigenous women attending family court in the city. 7, advocating for a citywide campaign looking at the role of racism against Indigenous people in Toronto. And 8, we would like to advocate for more programs that address violence from within our community. Strategic direction number 3, which is harmonize programs and services. So examples of what we are recommending under strategic direction number 3 are anything from support new and existing palliative care programs that integrate Indigenous worldview. This could be a system of healers and elders that are on call for people that are approaching end of life and are asking for a traditional end of life ceremony. Or 2, mental health and addictions services for Indigenous people, which are supported by a seamless network of culturally secure and trauma-informed care providers. We recognize that this network would be made up of both Indigenous and non-Indigenous healthcare providers. So number 3, we want to support culturally secure public health programs for physical activity, healthy eating, mental health promotion, healthy parenting, youth resilience, and chronic disease prevention in partnership with Indigenous organizations. 4, we want to explore the need for a live-in family healing and caring lodge. So really conduct a needs assessment surrounding that. So what happens next? Well, both organizations, the TC-LIN and TPH, will develop implementation plans in response to this strategic plan and present these action plans back to the Toronto Indigenous Health Advisory Circle. Toronto Public Health will be coming back to the Board of Health by the end of 2016 with their implementation plan. And the THAC will continue with their mandate to guide and advise Toronto Central LIN and Toronto Public Health in their work with Indigenous peoples in Toronto. The work isn't done yet, but we're getting there. Next. So I want to say a big Nyahweh Miigwech for letting us present today. This is such an honor from both sides of the table to be able to work together like this, and I think it truly shows that Toronto is invested in its Indigenous community and that each side is very committed to the well-being of each other. Miigwech. Actually, I would also like to introduce Ellen Blay from Toronto Central LIN. Ellen.
Hi there, my name's Ellen Blay, and I'm the Toronto Central LIN Aboriginal Health Consultant Lead. And what I wanted to do today is just invite Joe Hester to come up with me and say a few words.
Seated?
Okay. Hi, everyone. My name is Joe Hester. I've lived in the GTA since time immemorial. It was a great pleasure to participate here today to bring forward something that we feel strongly about, but also to recognize the partnership with the city and our community and Toronto Central LIN. Excuse me. This past week we had one of our physicians, some of you may have known him, Dr. Shaw, has retired. And I just learned a little while ago that Dr. McEwen is also retiring. I've worked with Dr. McEwen over the years. I think the earliest I can recall, maybe he has a better memory than me, but when we established the cold weather alert, where a number of services would be implemented to deal with the cold weather that came. And I think that was a significant point to move forward on in working with Aboriginal homeless in the city. But today, I want to recognize Dr. McEwen for his effort, his work that he's done with our THAC, Indigenous Advisory Circle. He has attended almost every meeting, and that's significant given a man of his schedule, and we certainly appreciate it. Okay. David? This is a blanket, Pendleton blanket that we wanted to do as a token gift in our appreciation for your great help.
Well, thank you very much for your presentation. We're going to weave in some deputations now from folks who are going to speak to the report that's before us. I think I'm going to invite you to maybe sit back in the audience. After we finish the deputations, I'm going to invite you back to perhaps answer any questions and to just answer any questions at that point. So we do have 4 deputations on this item. Just for the sake of everyone in this room, so when we have deputations, the rule is you have 5 minutes. And I have to be pretty strict on the 5 minutes so that I am fair with everyone. There may be questions after the deputations that the board would be permitted to ask you. And then basically I will invite you to go back to your seat. If there are any people who still wish to depute, I'll get it right sooner or later, to depute on any of the items before us, you have within the next 5 minutes to register with the clerk and get on the list. Otherwise, we're closing the list in basically 5 minutes. So on this item, we have 4 deputants. Gary Thompson, Karen Buck, Sarah Wolf, and Dr. Janet Smiley. So we'll start with Gary Thompson. You have 5 minutes. Thank you.
Yeah, good afternoon. Glad to be here on this vital topic, a reclamation of well-being. Quote page 5, Indigenous people living in Toronto face a disproportionate burden of challenges across known social determinants of health, as well as barriers to accessing health services. Indigenous people experience higher rates of poverty, unemployment, homelessness, involvement with child welfare, food insecurity, and challenges within the education system. Christopher Columbus, from his journals, spoke up about the destruction of Turtle Island. For this, he was shunned and died poor and unwanted. St. Michael's Hospital, I'm at the emergency room nursing station. An Aboriginal man, Mr. S., quite happy that St. Mike's is sending him by taxi to another treatment facility, and he is telling others in the waiting area. All of a sudden, the ED room fills wall to wall with police officers. Quote, police officer, nurse, get him out of here. A couple sitting in the waiting area, quote, wife to the officer, look at what you have to put up with. I replied, look at what Mr. S has to put up with, 500 years of state-sponsored genocide. Her husband gave me a nod of agreement, and the police started eyeing me with contempt. Kathleen Wynne, quote, when she was Minister of Aboriginal Affairs, I was on the res talking to the elders. They want to get a program together to plant trees. The next sentence is, there's a chromium mine going in on the res. David Zimmer, present Minister of Aboriginal Affairs, quote, Gary, stop making politicians aware of what's going on. I'm trying to save his life, and he tells me this. My recommendation to those that conquered Turtle Island, best heed some of the wisdom of the Indigenous peoples and that of their own ancient wisdom. Stop needless suffering. You saw me hungry. You saw me homeless. You saw me dying the lack of oxygen. You are not part of me. Quote, page 8, the best way for the circle to work together is through a harmonized approach. This means that all meetings and ways we work together are guided by elders and individual youth. It is intergenerational, involves healers and different ways of knowing. Lee, Health Equity Specialist, Circle Secretariat. A lot of healing needs to happen, a heck of a lot of it. Thank you very much.
Thank you very much, Gary. The custom here, the protocol here is, as much as we love them, we don't usually clap, but just so you know. Karen Buck is our next deputant. Welcome, Karen.
Well, I think that this new report is wonderful, and the getting together and having an advisory circle with the Aboriginal and the city working together is wonderful. I do want to raise an issue where I think the city is letting the Aboriginal population down right within the city and perhaps also globally. So I'd like to say that I am concerned that these vulnerable populations that were identified in the Highland Creek treatment plant, and I gave each of you the West Hill community profile so that you could see what we're dealing with. The community of West Hill, where the Highland Creek treatment plant is located, will experience all the impacts associated with the recommended biosolids management most intensely.
Karen, with great respect.
I think this is really, really important.
I do too, and in fact, we had a big council debate on it, and I think my vote will reflect that I was sympathetic to your perspective, and as some of us on this.
But I think that
However, Karen, hold on.
I would like to finish, please.
I'm going to let you finish. I'm going to give you 1 minute, but that's about it, because really this is not germane to the report that is before us, with great respect. So that's going to be my ruling as chair. So you have a minute to basically focus on the report.
So it is the city's commitments to the Aboriginal peoples who live within its boundaries to make sure that they live in healthy neighborhoods. You have made commitments in healthy by design and strong neighborhoods, and yet some of the decisions that you do make, that the city makes and council endorses, are not actually that supportive of the Aboriginal community. And as supportive of the Aboriginal community as they could be. It's not only the local community, but it's the global community as well, where we're looking for huge support from the city to make sure that climate change does not affect, that the city is doing their best with climate change to make sure that the temperatures in the northern part of Canada do not put the Aboriginal peoples there at risk. And cities are a huge source of climate change emissions that need to be controlled. I've just come from a wonderful conference on climate change, and I've also distributed this report that should go to every municipality, individual, and the Canadian government. It's acting on climate change together to make sure that we don't ruin this world for the sake of our children, because they are our inspiration.
Thank you very much, Karen. I appreciate it. And we do have the report before us. Our next deputant is Sarah Wolf, Toronto Indigenous Health Advisory Circle. Just hold on.
I'll be out of here in a minute. Do you have enough room there?
I think they, can you hear me from here?
So I'll just clear up. Thank you.
Welcome.
Thank you. So greetings to everyone here today. I'm Sarah Wolf, and I am an Indigenous registered midwife at 7th Generation Midwives Toronto. I live in the dynamic Ward 20, Trinity Spadina, Councillor Cressy, and I work in the heart of the vibrant Ward 28. I don't know if Pam McConnell's here, but I work right in Regent Park, which is very vibrant. So I'd like to acknowledge everyone who's here, and thank you for hearing me today. I would like to acknowledge Sam and the Youth Council from the Toronto Indigenous Health Advisory Circle, and he is a remarkable representative of the really vibrant and dynamic youth that are Indigenous youth that are in our city right now, and they are our future. Also to acknowledge the elders and the youth and the peers that worked on this strategy with me. I also wanted to acknowledge those who are doing the work alongside our people from all the programs and services within Indigenous organizations and without. And I acknowledge those who we've lost prematurely, whether it was to violence, to shame, to addictions, to suicide. We have infant mortality rates that are 2 to 4 times that of the national average. And we have a legacy of child protection policies that continue to take our children from our families, which is something that as a midwife, I unfortunately and sadly I see far too much. So this report that the community is, who is for this community, I see this as being something that we can use to better our future generations for those faces that are yet to come. So I'm here on the heels of the historic announcement by Premier Kathleen Wynne, apologizing for the province's role in perpetuating the legacy of colonization and announcing $250 million in new initiatives as a measure to respond to the Truth and Reconciliation report. This first ever Toronto Indigenous Health Strategy was created exactly in that spirit of reconciliation, and for this I applaud the Toronto Public Health and the Toronto Central LHIN for this initiative, which has been several years in the making. So I think, you know, as Sam said, we are driving that change nationally. For the last several years, I've been involved as well in a local Indigenous-led population health survey called Our Health Counts, from which some of the preliminary data is in the report. And my colleague, Dr. Janet Smiley, will be speaking a little bit about that as well. But with it, I believe we will conclusively prove the disparities in many of the health outcomes that our people have been reporting in this city for years. Disparities in infant, maternal, child, chronic and infectious disease health outcomes, mental health outcomes. As a midwife, the primary focus of my work day to day shouldn't be making runs to the grocery store so that, you know, a pregnant Indigenous mom has something to eat to feed her unborn child. to finding, safety plans so that she can get away from the violence that she has to live with in her household, to support her through child protection intervention. This is on top of supporting her disproportionate burden of health challenges in her pregnancy and supporting her to get culturally supportive specialist care that recognizes her vast challenges. And that's not just a one-off story, it's sadly a story that we see over and over again working as a midwife. What's remarkable is how strong and vibrant and resilient the women and the families in our community are. I know this strategy, the first urban Indigenous health strategy, and again, as Sam say, the best one in the world, is one that the Board of Health, the city, the broader healthcare system will embrace. So I'm asking that you now hear that when you leave here today, that each of you will look at what else you can do in your work and in your neighborhoods and within your families to support this initiative. The plan is ambitious. Creating an integrated and collaborative system to reduce health inequities will take an enormous effort from all of our partners, all of our stakeholders, our care providers, and community members. The gaps in the determinants of health, which we will soon hear about again, are beyond comprehension, with far too many living in poverty, being homeless or underhoused, hungry, experiencing violence of many kinds, including racism, in our communities and in our healthcare system. It has reciprocal impacts in our education systems and our justice systems. Equitable funding for the number of Indigenous people in our city should reflect the number of us that will be undercounted, no more. This includes for our Indigenous-run programs and those programs within the mainstream health care system, something we know is possible and can be successfully demonstrated as it is in the Toronto Birth Centre, an Indigenous-run facility. So I'm proud to say that I have been involved with this amazing circle and this amazing initiative, and my call to action is that the board implement it and support it with its full endorsement and its fullest ability. Miigwech.
Thank you very much. Are there any questions of the deputant? Thank you very much.
I just also want to make one more plug for more bike walks in the city.
Sorry, more? Oh, bike locks, okay. Like locks or lanes? Okay. Yes, okay. Thank you. Next is Dr. Janet Smiley, Well Living House, St. Michael's Hospital. Welcome.
Tansy, Nana Tuewun, Mequanasqueo, Netansini Kassen. My name is Janet Smiley. I'm a family physician and health researcher based here in Toronto at St. Michael's and University of Toronto. I also had the good pleasure of sitting with the Toronto Indigenous Health Advisory Council in my role as a volunteer. But I put today my public health researcher hat on because we've been citing some figures that might appear to be controversial. So what I wanted to do is just speak to some common myths that we have about Indigenous people. So the first big point today is actually the majority of Indigenous people in Ontario, which actually has the largest number of Indigenous people of any province or territory, live in urban areas. And in fact, that's close to 80% of the Indigenous population in the province. So we don't really have alignment of our policy tables or funding. The other big piece of evidence, and I would just say again, I'm very honored to sit here with my colleagues, Joe Hester and others like him who have been doing work for many decades in the city, and youth like Sam Klostra, and my colleague Sarah Wolf, who I've worked with for many decades, and the partners at the Toronto Central LHIN and Toronto Public Health. For my own part, I've had some opportunities for advanced statistical training and actually sit on the National Statistics Council of Canada. So I made a joke, I'm one of few Indigenous people in the city, I think, that was very excited to get the long-form census. So there's a couple others. So basically, the study is actually a CIHR-funded, peer-reviewed study, and we have biostatisticians, so we don't take challenging the census numbers lightly. But the issue really is that the census primarily relies on voting registry, and we've found in previous studies that have been published in peer-reviewed journals that Indigenous people aren't participating to the same degree as other Canadians in urban areas in the census and the NHS. So we found very low rates of participation. So we have a population-based sample of over 1,000 Indigenous people from Toronto. So we have irrefutable evidence. My biostatistician colleagues tell me that the NHS undercounted us by about half. If we extend that right to other cities, and in fact we found similar things in Hamilton and in Ottawa, this means actually that there's an even bigger unmet need. The other thing that's a big myth is our health outcomes don't unfortunately improve in cities. So you heard from my colleague and friend, midwife Sarah Wolf, that the infant mortality rates for Indigenous children here in Canada are 2 to 4 times higher than for the general Canadian population. And what's really sad is that doesn't change in cities. So even though people have access to high-quality facilities like St. Michael's, there's a lot of barriers and unmet health needs. So unfortunately, the instance of systemic and attitudinal racism that we heard from the first deputant are not rare. So I've also had the opportunity to work with the Wellesley Institute and do a systematic review of racism and its impacts on Indigenous health, and it's extremely prevalent. So there's huge barriers, but I guess one of the things is that we can address them, and there is an opportunity to address them because racism is actually something that we can address at the individual and systemic level, but it takes a lot of work to do it and motivation. I would echo the unmet needs then for a relatively affluent country like Canada are simply unacceptable and unjust. So unmet needs like poverty, food insecurity, and housing. And I think Sam might have flipped the data around a little bit. So what we find is actually the NHS is more likely to have participants who are housed, right, and who are more highly educated, perhaps not as threatened by government data then because they've been able to advance a little bit in mainstream social systems. So it's actually, the NHS has a participation bias that's quite strong in terms of actually under-participation for people who are homeless or marginally housed or poor, which is why we see that LICO, which really is having to spend 20% or more of your income than the general population. Some people are nodding, just in case you're a data geek. So the last piece that I wanted to leave you with is TRC and this action plan are a rare second chance to actually do something about these unjust and immoral health inequities for Indigenous peoples, Canada's First Peoples. So we already had a lot of recommendations in the Royal Commission on Aboriginal People, and it sat on the shelf and gathered dust. So, like I'm really pleading, the answers lie in our communities, and we have a way of accessing the answers now. You have a strategy, and we have a partnership, and we've had that participation. So please follow the model of Dr. McEwen and don't let this report gather dust, okay? This was the easy part, coming together with the strategy. The hard work and the investment and the resources are going to be transforming it into reality. Hi, thank you for your time.
Thank you very much. Are there any questions? We have Trustee Glover.
Okay. I'm very curious about the methodology because at the school board, we've also found a doubling of the number of students in our census who acknowledge Aboriginal background. So it's a huge gap. I didn't quite understand. You said that the census was depending on the voting registry, which seems to be like a really blunt instrument because only 45% of people vote in school boards and 55 in the city. So what was the alternative methodology that's bringing up the bigger numbers.
Yeah, so a starting point for this census, so we all get something that, for those of us that lived at a fixed address, we got something in the mail reminding us, and it said the resident, so that, I believe that mailing list comes from voting registries like who voted. But the method we used is called respondent-driven sampling, and it's been emerging over the last 10 years, so it is a recognized sampling technique. And basically, you start with convenience samples. It's a chain referral, but we use fancy gaming statistics to adjust. And it builds on a huge strength that we have in Indigenous communities is we have these awesome social networks. Plus, we worked with Indigenous community partners, some of whom you've heard from, and they have an awesome ability to engage diverse Indigenous communities. So it was really a bias for us. So we recruited our own people using social networks and used information about the social networks so that we could adjust for the convenience of the sample. So it's based on like probability statistics, so 6 degrees of separation and we're all related. So what we do is a post-sample weighting for people that are interested in those technicalities. We can, by time you get, if I give you a coupon, you give someone a coupon, by time you get 6 degrees away from my original coupon, that's called a chain, then we're starting to approach a random sample. So that's the new method that we've been using with some success.
Very interesting, thank you.
I'm glad you understand it, Trustee Glover.
I don't feign understanding, but I will go and look at the report now and see if I can.
Okay, great. Any other questions? Okay, in which case I'll again thank you for your deputation, much appreciated. Okay, now we'll bring it back, we'll bring it into the board and ask for any questions of staff or frankly, the presenters. Any questions? Okay, seeing none, before I'll invite you to speak, Dr. McEwen would like to say a few words.
Thank you, Mr. Chair. I'm not the main speaker on this item, as you've seen, and there's very good reason for that. It is a community document, and you've heard of support coming from the collaboration that occurred, particularly with Anishinaabe Health, Toronto Central Lynn, and Toronto Public Health. It is a document coming from the community. It's based on data, as you heard from Dr. Smiley, that was derived from the community. It is Indigenous health in Indigenous hands. However, it is from now on up to the Toronto Central Lynn and Toronto Public Health to make it our document and to allow it to guide the work that we do working with this community that has very high needs. I just wanted to briefly recognize two people, one of whom you've heard from, Ellen Blais, who was the staff lead from the Toronto Central Lynn, and our own Lila Monib, who is our staff lead. They are the team who did some of the initial work in terms of community consultation to help create the circle, and they have been stalwart supporters of the work of the circle all the way through, along with, of course, the very, very impressive youth council and elders and community leaders who made up the circle. So it's been a tremendous collaborative effort, and although it's not the most important part of this initiative, I just did want to flag that more than a year ago, we started on a very sophisticated collaboration between Lynn and Public Health, which is something which was recently called for by the provincial government as a new way of working within the health system. So this, I think, is a very good example of that kind of collaboration and was particularly appropriate in this instance. So I just want to give my personal thanks to all of the staff who were involved from all of the organizations in creating this document. And Toronto Public Health will be committed to reporting back on how we will be implementing the recommendations that are appropriate for public health. And I didn't want to leave out Nicole Welsh, who's sitting over there. She's the director lead for this initiative and Lila's boss. And she also was the lead for our Syrian refugee response.
Yes.
I didn't want to forget about Nicole. So thank you, Nicole.
Thank you for catching that oversight, Nicole. Are there speakers from the board now? Councillor Cressy.
Thank you, and I'm happy, as a member of the Aboriginal Affairs Committee here at the City, and as someone who began my career working in Fly Ojibwe and Cree communities, to move the recommendations in front of us. We just spoke about the Syrian response, and I think as a city we often, in recent times, like to pat ourselves on the back for being a welcoming city. Our history says anything otherwise. In fact, Our history, for many, is that of a colonizer. That's my own history. Our history, for many, is that of a country that practiced cultural genocide. It's a history that has left a painful and lasting mark on our country as a whole, and certainly, and most evidently, Indigenous peoples. Toronto has the largest and most diverse Indigenous population in Ontario. Meanwhile, Indigenous people in our city suffer from a disproportionate rate of homelessness, suicide, unemployment, the list goes on and on. The Indigenous health strategy, importantly, is being led by the community. There's an old saying, nothing about us without us. It's a principle as it relates to self-determination. This strategy has reflected that. It reclaims Indigenous governance as a health practice at the forefront, and it tackles the social determinants of health. This morning we heard a lot about reconciliation from our Premier, but reconciliation means more than addressing history. It means tackling issues for the future, not as a strategy to sit on a shelf, but as a living document that will help to ensure greater equity and reconciliation. And I'm happy to move the recommendations.
Great, thank you. Any other speakers? I think Councillor Cressy said it as best as anyone could, so I'll take the vote now. All in favor of the motion? Motion before us from staff? Opposed, if any? That's carried. Thank you very much, folks, for coming. Miigwech, this was a very good conversation that we had this morning, and I thank you for initiating it. Thank Dr. McEwen also for his leadership on this file. I'm sure he appreciates the accolades. He'll be getting many more, I'm sure, in the next few weeks, but I know he took a very sincere and personal interest in this, and the fruit of that work with the community is starting to yield some good fruit, and that's amazing. Okay, thank you very much. Our next issue is the legalization and regulation of non-medical cannabis. Now, we don't have a presentation on this particular item, but I do want to make sure that, and we do have a list of about 8 or so deputants. We are not speaking about medical cannabis and regulations and enforcement related to medical cannabis. This is a different kind of report, and I know because it's been in the news and enforcement has been in the news that you might think that this is a forum to do that. This is not the forum if you're focusing on the medical use of cannabis. So there are a number of recommendations before us here. My hope is that people really focus on the report that is before us, okay, to guide our deliberations on that. So we have a number of deputants. We'll start with Dr. Jürgen Rem, Director, Institute for Mental Health Policy Research at the Center for Addiction and Mental Health, followed by Viresh Fernando. Dr. Rem, welcome.
Thank you. Thank you for inviting me, and I will try to really focus on the 3 recommendations which are in front of us. For the Center of Addiction Mental Health, we welcome this report very much. We had released a policy paper in 2014 where we laid out that legalization with strict regulation is the best way forward, and this report seems to underline this spirit again. Basically, we are in a situation where it becomes clear that in 2017 we will have legalization of cannabis. For a lot of people, this is the end of the debate and the discussion. The truth is that with the legalization, we only have a starting point for actually getting the cannabis question right. And we want to underline that we should do everything to initiate steps to basically regulate cannabis in a way that we minimize health risks of cannabis. Cannabis is a psychoactive substance, and while in our report we've laid out the different arguments for and against legalization and believe that overall we are for legalization, that does not mean that at this point we should not talk about the risks of cannabis and what regulation should do to minimize those risks. So the first recommendation on developing a regulatory framework which uses an evidence public health approach is really what is necessary for cannabis. That includes regulation of access to cannabis. It is not a easy question, and we have to get right those different questions of what we can regulate and how can we control the substance which is actually sold. From alcohol and the history of alcohol, we know that governmental agencies are probably the safest way to regulate cannabis, and that is part of the evidence base which will be discussed within those regulatory frameworks. Overall, Canada needs an approach to cannabis which puts public health first. And that means not only public health in the sense of mitigating against chronic disease, it also means safety and all of the considerations about cannabis and operating machinery, including, of course, driving and traffic. The right set of regulations, if we implement it carefully and we evaluate those implementations, is therefore necessary. And that brings me to the third point of the recommendation, which is calling for a monitoring framework. This is absolutely crucial. We need to have baseline measures in the beginning, and we need to see if those regulations, which are partly formulated on our experience with other substances, legal substances and illegal substances, but a lot will be coming from the alcohol field because cannabis in legalization will be one of the first nations to do so. The situation in the states of the US is different, and we cannot use a lot of their experiences. So we will try to give the best evidence to plan the step forward, but we'll have to be open if we get something wrong to actually correct those things and get it right. And we can only do so if we have an ongoing monitoring system. These are all of the reasons why KMH is really welcoming this report and all of its 3 recommendations. We should use a public health lens in developing the regulatory framework for cannabis. We should, of course, earmark funding for research on potential health impacts. That will be absolutely necessary to also convince those who currently are skeptical about the approach, and you've seen some of the deputations. And we should also develop and fund a monitoring framework, because that will enable us to successfully get it right and improve. Even if we have gotten it overall right on the first try, there will be some little screws which we have to finalize. That was my deputation. Thanks a lot.
Great, thank you very much, and thank you for understanding the time restraints. The questions, Councillor Cressy.
Thank you, and thank you to CAMH as well for being here today. What are the negative public health impacts of the criminalization approach that has been used for the last century or so?
Well, the negative consequence of the criminalization approach are threefold. First of all, it did result in the criminalization of a lot of young people, which basically branded them for lifetime. It got a lot of punishment and legal consequences for simply using cannabis, which should not be the case. It was actually one of the most pronounced problems with the criminalization approach. Secondly, it didn't work. While Canada had a criminalization approach and prohibition, it resulted in Canada having the highest rate of cannabis within all of the 196 member states of the World Health
Didn't act
Organization.
as a deterrent.
It didn't act as a deterrent.
Yep.
And thirdly, it enabled an illicit market and a contact of our school children with this illicit market. So they were actually in contact with people who would also sell other drugs.
Yeah.
And those three reasons alone would be enough for abolishing the approach. But at this point, as I try to make sure...
If I could, I just have some other questions.
Yeah, sure.
So you alluded to that, given the failure of the criminalization approach from public health, getting the cannabis question right, as you put it, it requires us to put a public health approach first and foremost from a legalization framework. That's right?
Yes.
Okay. So what are the different types of regulatory items that we need to consider in ensuring we put a public health framework first?
A, we have to control the product. We would not sell milk without control. Why would we sell cannabis without control? Mm-hmm. B, we have to be clear that there will be a market, but we would also not allow minors to participate in this market. C, we have to control the quality of the product and the price. The pricing has to be based on considerations which make it unattractive to be in the illegal market and to be the only product or the main product in town. Thirdly, we have to make very clear that cannabis, as any psychoactive substance, should not be an ordinary commodity. We would not allow a marketing and advertisement as for any other products. And fifthly, we have to get the whole system in a way that the public is educated about the harms, the potential risks, and other considerations about cannabis. Okay. Currently, we have a very lamentable problem in that even students of the U of T, non-representative sample, but still quite large sample, most of them believe that cannabis is improving their driving.
Right.
That makes no sense.
So
finally, we have to have the...
You've got great lists. I have one final question, though, if that's all right. So I understand, so some of the considerations, content, price, age appropriateness, distribution, education, driving. Do we need to also find the right balance between over-regulating a substance to the point that it furthers an illicit market and not under-regulating a substance such that you normalize behavior, especially amongst young people? Do we have to find a balance around that regulation?
We do have to find a balance, and I see this balance especially with price.
Right.
And that is why we have to deal with pricing in regard to a potentially illegal market. Same thing we had to do with illegal alcohol at the time when we reinvented alcohol as part of the civil society after
Now we're
Prohibition.
reinventing cannabis. I got you.
Exactly.
Thank you kindly.
Thank you very much for your thoughtful comments. Other questions? We'll move on to the next deputant, Virish Fernando. Welcome.
Thank you, Councillor Mihevik. My name is Viresh Fernando. I live and work in Thorncliffe Park. My councillor, John Burnside, has just deserted me. I guess he doesn't want to hear what I have to say. But John and I are old friends. I do not own a cannabis store. I am not a user. My preferred poison is alcohol, single malt scotch if anybody wants to give me a gift. So you're probably wondering why am I here? I'm here because of my background. My background is as a constitutional and a human rights lawyer. I practice litigation on a day-to-day basis. And I say that, but I'm really nervous and scared being in front of, in the presence of 200-300 people here. I think that Councillor Mihawik, there is a real serious misunderstanding that has not been addressed in the media. My friend Jana Valeriani and I tried to address some of these issues in a Globe and Mail op-ed piece we did last Monday. I don't think anybody disagrees that millions of Ontarians use cannabis on a recreational basis. The issue is that right now they're getting it on the street. Mayor Tory has sort of said that we have to do something about the city budget, that we are completely strapped for cash and so on. I totally agree with Mayor Tory, which is an amazing thing because I rarely agree with Mayor Tory. So we should not be using precious resources of the city and from the police budget raiding stores as we did last week. I have estimated that it cost us about $120,000 to carry out those raids last week. Somebody told me this morning that actually it was $430,000. Now I don't know, but I think I would go with 120. As most of us in this room know, there is a system of purchasing cannabis for medical use, which we are not going to need to discuss today. What has happened is that even that system is broken down because there are 11 court rulings that have held that system to be unconstitutional. So in a sense, there is a legal void. We call it a lacuna in terms of the language we use. And so even that system is broken right now. What we have before us is a great opportunity to come up with a system here in Toronto and to be an international leader in terms of putting together a system that's going to work, whether you're buying it pursuant to a prescription, which actually will become obsolete when it's available recreationally, and when it's being sold to recreational users. Now, something really remarkable happened last Friday, and it happened in Edmonton, but it really impacts on us. Premier Wynne was in Edmonton, and she, in response to a question about the raids that were taking place in Toronto at that time, said that she believes that regulation of retail sales ought to be the responsibility of the city, which is amazing because up to that time, Premier Wynne, who by the way is also my MPP because John and I live in the same area in Ward 26, had basically sort of said, it has to be like an LCBO model. But when some of us started pointing out, look, you've taken out beer and wine sales from the LCBO, at least partially demonopolized it, and put it into grocery stores, you really can't call for a complete monopolization of marijuana sales. By the way, what happens is that, I don't know whether any of you remember your civics class, but being a lawyer, under the British North America Act, moment the feds decriminalize or legalize marijuana, it completely falls to the provinces and to the two territories kind of deal. The feds will not do anything about it, just like it is with alcohol, as the previous deputant said. So basically, if Premier Wynne's position has now changed, that it should be your responsibility here as city councillors and as the mayor of the city, then I think that this is a great opportunity, as Councillor Cressy has been saying over and over again on radio, that the city takes a very, very progressive approach. And I would urge the city to take the approach that the mayor took in terms of Uber. The mayor said, wait a minute, we can't say that this technology doesn't exist. We can't, okay, we'll do. And so we need to really go forward. And we have both Vancouver and Victoria as good examples. There has to be distance put between from schools, from places of worship, from stores next to each other, 3 on the Danforth, on the 300 block, crazy. And as long as we take that approach and the public health approach that Dr. McEwen has recommended and the 7 or 8 issues that were raised very correctly by the previous deputant, I think that the city has a very good opportunity to come up with really wonderful regulations, and I would really recommend the city to do that, to grasp the bull by the horns and to ride it. Thank you very much.
Thank you very much. Are there any questions? Seeing none, our next speaker is Kevin Hall, Chronic Pain Toronto, followed by Dennis Long, Executive Director of Breakaway Addiction Services. Welcome.
Thank you very much for having me this morning. My name is David George Oldham. I'm here in place of Kevin Hall. I just wanted to start off by recognizing that we are on Anishinaabe Haudenosaunee lands, and thank you very much for discussing this matter today. I fell really into this trade as a grower when I was prescribed medical cannabis by my doctor in treatment of symptoms of multiple sclerosis. Since that time, I've been put into a world where I've been blessed to hear of people fighting stage 4 cancer, arthritis, and numerous chronic health conditions that this last week I saw the city impact those people's lives. I would encourage this council to examine the report that Chronic Pain Toronto had submitted previously in December of 2015, originally commissioned by the city, with regards to the treatment of chronic pain and the pain epidemic in Canada and where the avenue of medical cannabis fits into that treatment plan. In 2014, when we saw a change to the regulatory framework of the medical marijuana access regulations that provided patients the ability to possess and produce their own cannabis, we saw a change to the program that allowed licensed producers to be the only legal accessible point of cannabis for those patients. That drove up the cost of the actual medication to the point that it wasn't accessible for those patients, and dispensaries have filled the gap for the last 2 years. I was very happy this morning to see the cooperation with the Indigenous community of Toronto, that we seem to be moving forward, and it's really that type of relationship that I'd like to encourage with the patient community of Toronto that I see right now. We're being somewhat put to the wayside, as the recreational use of cannabis is something that needs to be considered. I would find its medical application more prudent. Really, my submissions, if I could keep them brief, I do understand, like I say, that recreational use seems to be the focal point of this report, and I was somewhat surprised to see that, but again, would encourage that for people just hoping to have more days holding their children without pain. Myself, I love just walking through the park with my dogs, and it's cannabis that's keeping me, that's allowing me, pardon me, to maintain that quality of life. And I appreciate the growers and processors who have put themselves in risk for the last 15 years to allow me to maintain that quality of life, and would hope that the fine members of this council could begin to work with those parties alongside other members of this trade to provide the solutions that patients like myself need.
Great. Thank you very much for your presentation, Kevin. Any questions? Seeing none, Dennis Long, Executive Director, Breakaway Addiction Services.
Good afternoon.
Afternoon.
Good to be here again.
Good to see you again.
Thank you. I'm the Executive Director of Breakaway Addiction Services. We've been treating young people from the ages of 12 to 25 with drug-related problems for the past 27 years. I'm also a professor of addictions and mental health at Humber College and Guelph Humber University, just to sort of flesh it out, and a member of the Drug Strategy Implementation Panel. I'm a strong supporter of legalization of recreational use of marijuana. And I'm a strong supporter of this report because I think what it does is take a very clear-eyed, realistic look at how we have to go about developing some way of rationally incorporating this substance into our society. If we don't do this, we're going to screw it up, to be honest. But I think the other thing is, as I was driving here today to make this presentation, I was listening to CBC Phone-In on exactly this issue. And it struck me the gap between reality and public perceptions of this substance. And it is vast. And we are enmeshed in a lot of myth and misrepresentation about this substance, people don't really know anything about marijuana, despite the fact that it's been around in popular use now for 4 or 5 decades. We really do need to have regulations that reflect current realities, current research knowledge, and we need to build a basis for increasing that research knowledge, which is woefully inadequate. And the reason it's woefully inadequate is we've criminalized this stuff for the past 100 years and nobody's studied it. So we really have to have that in place in order to do this. And when I say myths and misrepresentation, I think we need to get to drill down to what's the real truth here. The other thing that I've seen as a clinician is that a lot of people have, well, there's a certain sense of moral panic coming out. Okay, we're going to legalize recreational use. Oh my God, our kids. Well, what I've seen in the past 27 years is that pretty much any kid in high school in this city can find marijuana within minutes any given day. It's there. It's real. It is something that kids have been living with now for 20, 30 years. We have to really accept that. And what we're doing here is beginning to look at a new page, a different way of approaching this, which will get kids out of the underground network where they've been used to get stuff, and adults for that matter, and possibly reduce the illegal trade in a substance which currently, with the exception, of course, of medical marijuana, everybody has to access in order to get the drug. The regulations, as I said, have to establish norms for behavior, and they're not going to be easy. They're going to be complicated and difficult to do. I hate to say this, but I really do need to say it would be really useful if the federal government would provide us a little bit of guidance in the interim right now, because they announced a few months ago, okay, we're going to legalize this, and it doesn't look like going to get around to it in any real sense for a year, and meanwhile, we've got nothing. And I think that every, municipalities and other regional governments are saying, well, what do we do? I think there needs to be some real firm guidance from the feds in order to, well, this is what you should do in the interim. We have to avoid a moral panic. We have to avoid going down the old road of the evil drug and how do we control it. We need to be clear, and we need evidence-based approach to developing regulation. Thank you.
Thank you very much, Dennis. Are there any questions? Yes, Councillor Doucette has a question for you.
Thank you very much for coming here today. I must say I have learned more about cannabis, marijuana in the last few weeks than I have in my entire 50-something years I've been on this planet. I grew up on a very small island as well, so. So if and when the federal government does legalize, the report we've got before us today, would you agree that because we're looking at this even with an evidence-based approach, it should, this is going to sound strange coming from me, improve the product in the way that it would be purer and not so many of these horrendous things I'm hearing are added into it and then sold on the street?
Well, again, that goes back to the issue of the mythology. Yeah, there are some substances on the street which were adulterated. It's not that common, to be quite honest. And I guess that's the other kind of danger thing that we have to really get to the thing. Yeah, quality control is important. If you go to one of my favorite stores, the LCBO, and buy stuff, there's all kinds of people who regulate that the production of that substance. I know if I go and buy X, it tells me right on the bottle what I'm getting and what the potential. That's where we have to get to with this substance. Albeit now it's an organic substance, it grows, but we can do that. And I think that's what would give consumers more confidence. And if you go into a store and somebody said, well, there's this much THC, then there's this much THC. Some people don't want so much, some people may want more, so you'll be able to make that choice. Yes, I think that's absolutely true.
And you're also touching on about the federal government has left everyone just hanging in this gray area, so to speak. Would you agree it's been quite difficult for municipalities to come up with rules and regulations, because we could come up with something now and all our businesses would go out and accommodate what we're telling them to do, and then the federal government could come in and go, oh, no, 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 you know, you can be 200 meters and we're saying 300 meters. So you agree that it's really left
I think it's a
everyone
mess,
hanging?
to be quite honest. I think, you know, I mean, this kind of, yeah, I understand to a certain extent political realities. You can't just sort of do it overnight. But on the other hand, it is really unfair to local legislators and rule makers to say, okay, in a year, this will be legal. If I was a police officer and somebody, well, you know, am I going to go bust this guy for something that will, in a year, not be a charge? How do you do that? And I think there needs to be some kind of guidance here to avoid the kind of Wild West, you know, because if I was somebody who wanted to establish a business in distributing marijuana, I would be moving now to establish my bona fides and try to build a market, because that would make sense, rather than waiting until the writ drops or, you know, whatever, the bill passes and some things I can then move with my business plan. I'm going to be starting now. So there needs to be some rules and regulations and guidelines for me to follow to go about that.
My last quick question. The recommendations you've seen in this report, is there anything you would want to add to what we're wanting to look at when the government moves forward?
Actually, no. I mean, the things that I found encouraging in the report is that it really takes the state-of-the-art knowledge that we have. The only thing that bothers me is to look at this and say, well, this is the state-of-the-art, because we don't know the effects of occasional use. We should, but we don't. And there's a number of other kinds of things like that that are not well explored. That's disturbing, but that's not a criticism of the report.
Thank you very much.
Thank you, Councillor Doucette. Councillor Cressy for questions.
Thank you, Dennis. I just want to follow up there. You mentioned a desire that it would be helpful to have some interim federal guidance and measures for municipalities across the country prior to a new federal regulatory framework. But do you think that interim guidance and measures, that they should also take a public health approach as opposed to a criminal
absolutely.
approach? Because interim guidance and measures mean many different things.
Yeah, and I think I mean, they have to avoid this I hate being critical of the federal government, but, you know, of saying, well, the law's the law, we got to keep following the law. Well, the law, as we've heard in the previous deputations, didn't work. So why should we continue to do something that doesn't work? And I think I'm absolutely on side with you. If we're going to establish interim regulations, which will be refined at a later date, then let's base them on clear research evidence and public health policy and harm reduction approach.
So, for example, if the federal government were to decriminalize possession today, from a public health perspective, is that one approach?
It could be, but again, it would have to be within some kind of regulatory control. So, you know, if you went and said, okay, well, you can possess, you know, you wouldn't want somebody carrying a bale down the street. So what would be an acceptable amount for somebody to possess and so on? Yeah, there's stuff you have to think about.
Thanks, Dennis.
Thank you.
Thank you very much. Our next deputant is Derek Moran, followed by Christopher Cardozo. Welcome, Derek.
I just want to first start off by saying that I acknowledge and accept the subscribed oath that you all took to be trustees of mine pursuant to Section 4 of the Public Officers Act. So I read through the report and Appendix A from the Medical Officer of Health. The part that stuck out at me was the federal law that provides designated psychoactive substances in Canada is the Controlled Drugs and Substances Act. Ironically, that act actually has an enacting clause at the beginning of it, whereas the City of Toronto Act does not. I just want to point that out. So this report seems somewhat incomplete to me. And my question to myself was, when I read this, what about the rest of us that don't work for the government that want to use non-medicinal cannabis? So I'll just elaborate on that. I met Mayor Tory at Joe Oliver's Canada Day picnic a couple years ago, and I asked him, do you actually know what the law is? And then I said, do you know what the default jurisdiction of law is? And he said, well, I would say that whatever it says in the Constitution. So if you go on the Federal Department of Justice's website, they have a whole bunch of stuff explaining the Constitution. There's something here called bijuralism. Canada is a bijural country. That means that it has both common and civil law systems. Matters of private law in Quebec are governed by the civil law, while the common law applies in the other provinces. Federal bills and regulations must respect both types of systems, and the legal concepts within these laws must be expressed in both English and French. This is directly expressed in the Constitution with Section 52.1, which states the Constitution of Canada is the supreme law of Canada, and any law that is inconsistent with the provisions of the Constitution is, to the extent of the inconsistency, of no force or effect. And then the application of the Charter is Section 32.1, which reads like a whole bunch of gibberish. Like, if you read it, anyone I've directed to read it and then tell me what you think about it, they get back to me and they say, I can't make heads or tails of it. So instead of reading the logical structure of Section 32.1, as Professor Peter Hogg explains in his Constitutional Law of Canada text, as cited in Eldridge versus British Columbia, Attorney General, 1997, Supreme Court of Canada, I'll just read what they summarized about it in Prigden versus University of Calgary, 2010, and R versus Whatcott, 2014, as they both cite the Supreme Court of Canada in RWDSU versus Dolphin Delivery, 1986. Professor Hogg's clarification that Section 32.1 has been interpreted to mean that the Charter only applies to government actors, government action, and not to private activity. In a nutshell, what I've just told you is Section 32.1 of the Constitution says that acts and statutes only apply to government employees. So when you speak in terms of legal, in terms of non-medicinal cannabis use, what you're really saying is that legal it means, oh, it's okay for government employees to use cannabis, and illegal means that it's not okay for government employees to use it. What about the rest of us, though? I don't care about legal. I don't care about legal, illegal. It doesn't matter to me. Why? Because Canada is a common law jurisdiction. Nowhere in the report does it even mention that. So like in the future, if you hear Mayor Tory or Bill Blair say, oh, the law is the law, the question that should be asked is, which law are you talking about? Which jurisdiction of law are you talking about? Because as of right now, as it stands, I wouldn't do this to go antagonize them, but I could go out in front of police headquarters and light up a joint, and they might try and attorn me to their foreign jurisdiction of law, which is Admiralty Maritime, that they act under. If you actually read the definition of Canada, it's not what people think. But these people, when you arrest one of these people for what happened the other day, the definition of person in the criminal code is actually Her Majesty and an organization. The first time Councillor Greb ever saw me at her budget town hall meeting last year, she did not go, you know what? That guy looks just like Her Majesty and an organization. Everything that happened the other day was basically false, 361 false pretenses, false arrests, because these are living men and living women. These are lives in being. That jurisdiction doesn't apply to them. They don't work for the government. I know it's a lot of cognitive dissonance for people to take into, especially for government, when they hear this for the first time. But again, acts and statutes only, yep, you gave the lawyer almost an extra minute though. Acts and statutes only apply to government employees, basically.
Thank you very much. Appreciate your comments. Appreciate you staying to time as well. I really do. Any questions? Seeing none, we'll move to Christopher Cardozo.
You guys understand though what I just said, right? Right? No, I don't want you guys brushing this off. This is important.
Yes,
You're dealing with your fellow men and fellow women's lives.
Yes, we understand. And if you do have a written submission that will help clarify a lot of that, we're also welcome to receiving that.
Well, you'd be more than welcome then.
Thank you. Christopher Cardozo.
Hi.
Welcome.
Thank you. My name is Christopher Cardozo. I'm co-owner of THC, Toronto Holistic Cannabinoids, second store in the city that was an open door policy. We served only prescription-only patients, yet we were still rated along with everyone else. First and foremost, I just want to go on record and state that it's absurd that there's a council meeting on the licensing and regulation of non-medical marijuana when the meeting for licensing and regulation of medical marijuana was deferred. When you prescribe medical marijuana, especially for patients who have cancer and immune deficiencies, seizures, Health Canada has an extra responsibility to look into these chemicals and what they're putting in the product, into the plant. Large corporations, the LPs, they have large facilities. They're closed to the public, and so we can't ascertain the exact processes in which the marijuana is produced, and if there are any additives or chemicals added to it. As a dispensary who only purchases from licensed growers, licensed by Health Canada for a long time under the MMAR program, these production processes are easier to check and verify because we go directly to the grower themselves. They're small grow sites. If there is an issue, it's easily rectified and fixed, much quicker than on a large-scale one. As for regulation, on the Health Canada website itself, there are outlined guidelines for compliance and enforcement, but they're very vague. Patients would be unaware of how often routine inspections are, and how long before the issue is rectified, leaving them vulnerable in the interim. I do recognize that this could be an issue for licensed growers also, which just shows there needs to be regulation of medical marijuana before it goes recreational. The silver lining here is the smaller grow operations, as I stated earlier, it would be easier to rectify and take care of these issues, and the patients are closer to the answers. It should be noted that patients that tend to opt for medical marijuana desire to opt for more natural medicine. Therefore, chemicals and additives need to be disclosed, and their legal precedents upholding the right to choose, especially since the current situation in our country is failing us. Basically, the dispensaries provide a service that the LPs aren't able to do, which is a face-to-face, in-person service, able to educate and explain and show how these plants are grown, shown what's going into them, goes with the marijuana plants themselves, edibles, derivatives, all sorts. It's easier to check and verify these things. Thank you.
Great. Thank you very much. Are there any questions? Okay, seeing none, thank you very much.
Thank you.
Lisa Campbell, followed by Tanya Longo. Lisa Campbell. Welcome, Lisa.
Hi, thank you. So I'm here today representing the Cannabis Friendly Business Association as well as Women Grow Toronto, which is a network of women entrepreneurs who are involved in cannabis locally. Today we're applauding the Toronto Board of Health for moving forward to endorse legalization. Personally, I've served on the Toronto Drug Strategy for many years as a youth representative, so it's a really important day for me to be sitting here today and that we all agree that no one deserves to be criminally charged for cannabis. I think that's very important and powerful. Last year, the City of Vancouver moved to regulate dispensaries, and during these deputations, the Chief Medical Officer of Health, Dr. Patricia Daly, stated that there's no difference between the harms of medical and recreational cannabis dispensaries. Other cities currently are licensing these small cannabis businesses, but the City of Toronto is launching raids. Instead of wasting these taxpayer dollars with unjustified raids, we could be working together to come up with sensible drug policy. Recently, the Canadian Centre for Policy Alternatives released a report stating that there's a loophole that allows vices to be taxed municipally. For years, the Toronto Drug Strategy Implementation Panel has struggled to fund its efforts, including community-based harm reduction programs, which have traditionally been excluded from federal funding. This is a huge opportunity to fund this work, including harm reduction, Just as the Beautiful City campaign generates $10 million of annual tax revenue from billboards for youth arts programming. So personally, I was really involved in that initiative. It was a youth-driven initiative. We worked with Councillor Mihevik to drive this forward and generate revenue for youth programs. Personally, I'd love to see the City of Toronto work with a drug strategy to come up with standards where we can actually generate revenue from these small cannabis businesses, license them, and use that funding for drug education for young people, for harm reduction programs, and other community services. Right now, it's ironic that the Toronto Board of Health has put forward this report as it's just days after the raids, which were the largest cannabis raids in Canadian history. Instead of punishing dispensaries, the city should be working together with us to craft regulatory framework, which includes small businesses, not just big corporations. The Supreme Court has already declared that Canadians have the right to access cannabis in all its forms for medical purposes. There's no reason to punish local cannabis businesses while the federal government licenses huge corporations. Thanks for your time.
Great, thank you very much. Appreciate your comments, Lisa. Are there any questions? Okay, seeing none. Thank you very much, Lisa. Tanya Longo, Brady Zerborg, Queens of Cannabis. Welcome.
Hi, I'm Tanya, and this is my partner, Brandy. We're actually here as patients today. The costs of enforcing illegal marijuana are outrageous. 22,400 individuals have been arrested since March of 2016. It's a waste of taxpayer dollars and resources. We need to start using these resources for abuse cases and rape and terrorism. What happened here in Toronto on Thursday was completely unnecessary and used as a show of force. Why do the arrests continue on the verge of legalization? Marijuana is not a lethal drug. It's unfair and unconstitutional to treat marijuana users more harshly than alcohol or tobacco users. The way edibles were attacked and portrayed during the Toronto Police Services press conference showed their lack of knowledge and education on cannabis use. We all know that the worst thing that will happen if you eat a medicated cookie is that you'll feel similar effects to that of a strong painkiller, and you might have an amazing nap. Yeah. We're not going to die from eating a medicated cookie.
So I'm Brandy Zerberg, here as a patient today as well. I agree with regulations. I've never come out. I actually called in the media for regulations to be able to protect the patients in the current market. Going forward for recreational users, this needs to be addressed as well, but it is not near the degree that you guys think it is at. It's unbelievable, the raids. Like, wow, cannabis and patients and cops and battering rams, it's pretty far stretch. So let me tell you a little something about regulation that needs to happen is we just need to know how much THC content is in our edibles. That's the only issue. And as Tanya just stated, you know, the worst thing that will happen is that you'll have the best sleep of your life. So I think those arrests, you know, I hope you guys feel ashamed about it. It's pretty terrible.
It's just up to the city to stop the arrests. Thank you.
Absolutely.
Great, thank you. Thank you for your presentation. Noting, of course, that we really aren't here talking about the arrest and what happened Thursday. We're public health.
Yeah.
Our job is just
realize
to
that.
look at the longer term, so I gave you a little bit of leeway.
Yeah, except for you guys wouldn't listen. You wouldn't listen to us at the time of the issues. We were given 72 hours and then kicked out. So what did you expect for today?
You guys
Public
here
health.
is
Well,
public health?
city.
That's not really before us. Yeah. Okay, but
Thank you.
I gave you some leeway to make your point. Great, thank you. We have next is Constantino Betsis, then Matias Marin, and the last speaker is Adolfo Gonzalez.
Want to come with me, eh? Okay. Good afternoon, respected members of the Board of Health. I am a 47-year-old retired professional who is a medical marijuana patient. However, I am not here with my 75-year-old mom and my service dog to talk about the medical aspect of your considerations. Although I do significantly echo the remarks made by Chris, it is offensive to me that I have been brushed aside as a medical patient so that the City of Toronto can begin to determine how many dollars are going to come from the eggs that they have counted. Enough is enough. You had a 25-page report that was buried as a reference in today's agenda items. Those 25 pages were reviewed by a blind man over the course of 5 days and have 82 pages of notes with them. The City of Toronto has made it clear in their report that they did not take care to examine all of their facts. In fact, more than 30% of the facts in the report are completely inaccurate, and as a Toronto citizen, I'm ashamed that the City of Toronto has proposed some of the "we're the second city in the world." We have data and scientific information. This report was written well after Justice Phelan's clear decision that medical marijuana patients must be put ahead of all other issues. Interestingly enough, again with the report, the City of Toronto seems to lean on the very evidence Justice Phelan mocked and clearly stated was not only inaccurate, but offensive. The bias from the very witnesses from the federal government's perspective was so clear that it was laughed at. We sit here with an opportunity to try and ensure that we do the right thing. We sit here with an opportunity to be able to open up two-way discussion that is new and fresh. I am not naive enough to think that all of these dispensaries are real. They're not. A good proportion of them are nothing short of criminal enterprises. Compassion? It is 50 cents to $1.50, $2 tops, unless you're one of the political cronies that's got an LP. How does a dispensary or a compassion club have the audacity to tell me that God's vagina is $530 for an ounce? That's affordable? Seriously. The City of Toronto has to take action, and that action must and will include citizens, not just of the city, but of Canada. I was not consulted, and based on everything I've seen, the only people that were consulted by this Board of Health either paid for it through lunches or made sure that they presented themselves as the end-all, be-all, de facto rulers of what our medical and our recreational system will look like. Congratulations to the LPs for being out there and making their profits. But we, as medical patients and as citizens, will be heard. Thank you.
Thank you. Next is Matthias Marin.
I'm just going to start with saying thank you, Councillor Hevick, for saying my first name correctly. My last name's Marin, but I'm Matthias Marin, and thanks for giving me some time to speak. So I read the entire report, and thank you to the Board of Health for producing this report. I'm not sure that I agree with everything in it, but I'm glad that this is at least a starting point. I'll introduce myself by saying, in full disclosure, I am a medicinal cannabis user. I have epilepsy. I went through many, many years of hundreds of seizures a year. That's grand mal, which led to me not going to post-secondary and having extreme difficulty keeping a job because employers fired me since I couldn't make it to work sometimes. Finally, eventually, I did take a chance with cannabis oil, and it helped me a lot. It's negated the majority of my seizures. I'm now healthier than I've ever been since I developed epilepsy. So I have a couple of recommendations I wanted to make that are absent in this report. First, I'm going to give you context on what makes me bring these recommendations forward. So like I said, my most positive experience with marijuana is my reduction in seizures. So great that I live what I would say is quite a normal life for someone who experiences seizures. But I've had many, many negative experiences as well. I grew up in Regent Park and the Esplanade. Both, as most people know here, are very diverse communities, and both have probably a disproportionate, like several other areas in the city, number of affected people by the criminalization of marijuana. My brother is schizophrenic. Had he been given good information over the years from those who were giving him information, such as his teachers, the government, the mainstream media, which all of you mainstream media who are here should be ashamed of yourselves for constantly disseminating incorrect information. Because of this, my brother was using marijuana heavily and was afraid to come to us when he began to have issues regarding psychosis. This developed further to the point where he had to go to the hospital, and he was subsequently hospitalized many times at St. Michael's in a mental health ward. Now he's better, but had he known the real consequences of marijuana use and not the reefer madness that was thrust upon us in Catholic school, and I'm sure public school as well, he may have been more informed and may not have used cannabis to the degree he did, knowing our genetic predisposition to mental health issues. I also have a brother-in-law who has MS, and because of the stigma associated with marijuana and his late father being a doctor, he refuses to try to use cannabis, even though his multiple sclerosis has effectively ended his life. He no longer works as a teacher, he stays at home all day, he can't drive, nothing. So the community that I lived in, as a white male, it was very evident to me that I was lucky because of the color of my skin. There was a disproportionate amount of enforcement on those who are of minority communities within my community, and that continues now. I am very dismayed by the fact that this report does not include provisions as to looking at the long-term consequences of legalization on these marginalized communities. Many of these people who currently deal in the black market will have to move to other areas of the criminal market to continue making an income. This will, of course, happen in other areas in the city, but these are the areas most disproportionately affected and most disproportionately policed in a negative fashion. So I would definitely recommend that we look into that. We look into the ways to mitigate the long-term effects of legalization on these communities and how we can economically stimulate them, socially stimulate them, and begin to repair the broken bonds that exist within our communities. I have one other recommendation, and that is that the Board of Health go about creating a campaign of information and not disinformation. For years, our youth have been very, very poorly informed, adults as well, as to the effects of cannabis. This is what results in bad decisions. I believe it is incumbent upon the Board of Health, considering how many other areas where they talk about public health education, to support a development of a public policy structure in which we begin to educate our youth and adults about the true risks and benefits of cannabis. Thank you for your time.
Thank you very much for your time, Matthias. Much appreciated. Are there any questions? Yes. Quick question, Councillor Cressy.
Yeah. Matthias, I just want to follow up. You were speaking about the impact on individuals, which is both it will be a social health and economic impact.
Absolutely.
Displaced from working in the current market, currently illicit market.
Yes.
What are some of the measures you would see that as part of a regulatory framework we should consider to support individuals, both, as you put, people who are marginalized and working from a low-income point of view, but also others who are working in a market right now?
I would say, number one, for the marginalized communities, if we are going to tax this the way I expect we tax the majority of other things in this country. We need to appropriate funds from that and direct it to doing social, economic, and public health development within these communities. As for those other people within the market that are more fortunate to not be as policed as the others, I believe just having fair access to regulations where, like we said, it's not a crony capitalism sort of situation, and where small businesses and big businesses are allowed to flourish together, I think that would be very ideal. But I do really think that it's important to take the risks, benefits, and the moralizing has to stop, and the disinformation has to stop. And watching the media interview a variety of people today outside of this room, the media continues to perpetrate misinformation, and they ask bad questions. Thank you, Councillor Cressy.
Thank you. Next, last deputant is Adolfo Gonzalez.
Thank you, Council, for having me. I'm here, my name is Adolfo Gonzalez. I'm here speaking on behalf of the Toronto Dispensary Coalition. I'm going to try to not go over a lot of the same points that were brought up by the people speaking before me and try to fill in the gaps a little bit. So I think it's important for the Council to consider why the city of Victoria and Vancouver chose to create regulations that were adherent specifically to medical cannabis dispensaries and not recreational dispensaries. The reason for this is because, as you know, municipalities have the right to regulate land use, okay? When the federal government comes around of making these decisions, what they will do for you guys is give you this wall, and then you will have to fill in the guts, okay? So this work will be necessary work regardless. Initializing these processes are processes that will need to be had when the announcement comes. It can start before the announcement comes, right? So I think it's very crucial that we look to those municipalities that have already started enacting these kind of protocols and ask ourselves, well, why didn't they choose to come out with recreational regulations? And, the reason for that being is that medical regulations are going to be the highest standard of regulations that you can come up with, okay? So think about how first you're going to take care of the people that are exposed to having the most fundamental right, almost as a Canadian, respected, okay, which is the right to choose your ailment and the right to choose your treatment and the right to be treated with dignity in the transcourse of finding this, okay? So basically, we need to think that those level of regulations are the kinds of regulations that you guys are going to want to develop. Why? Because those regulations with such a high statute and such high demand will adapt perfectly well to the recreational market. So basically what I'm saying is you're killing two birds with one stone, and you're creating the right regulations from square one by focusing on medical. And this is why Vancouver and Victoria have chosen to go this way. So it's important that the City of Toronto realizes that they're not fighting this fight alone. Municipalities elsewhere in the country have spent a lot of money and time and effort in talking to people like myself that have been involved in this industry for 15 years. We know the reality on the ground. We've been helping patients for a long period of time, much before the federal government even came up with regulations that dealt with these problems. We also need to keep in mind that the reason why these laws were changed to begin with was not because LPs were out there doing lobbying. From before 2001, dispensary patients, dispensary growers, and dispensaries themselves have been putting their lives on the line, their money on the line, and paying for the court cases that have brought us to this place in the first place, okay? So when the media and the federal system wants to paint dispensaries as being here to make a quick buck, paints us as people that don't care about the law, we care more about the law than anybody else involved in this situation, obviously. We've been putting our lives, our families at stake for a long time. So we wish for you guys to be aware of this, to pay heed to the reality of the history behind how we got here, and to look to other municipalities. Why have they chosen to tackle medical first? Because if you go for a recreational standpoint, your regs are not going to be something to look up to. Toronto is not going to deal with the issue in the most progressive manner. So I want you guys just to hear my words, pay heed to them, and please, the City of Toronto needs to utilize any influence that they have on the police force to drop those charges when these people get to their court proceedings. We, in effect, we need to deal with this in a progressive manner, and that is the most unprogressive move that the City of Toronto could have done. So this is basically what I have to say for you today. Thank you.
Thank you very much. Appreciate your comments, Adolfo. Are there any questions? I have a quick question.
Please.
So I'm going to ask the medical officer of health this. As I understand it, basically the federal government, their role, just in terms of the division of legal labor, the federal government's role will be to say yay or nay to decriminalization, yay or nay to legalization. They end there. Then the province will have a role in saying, okay, this will be the distribution mechanism. It will be through dispensaries. It will be through LCBO. It will be through new government agency, whatever.
Exactly, yes.
Then it will be up to the city to say, okay, there will have to be a distancing, land use planning kinds of issues.
Precisely.
Do you agree with that?
I do agree with that.
And so the question then, well, no, I won't ask it. I won't ask it. I'll ask it offline because I really don't want to get into the dispensary issue in this public health forum. But I'll ask it to you outside, perhaps.
I can't get you to reconsider. I'm sure I can respond.
It's okay. It's okay.
Okay.
Wait, thank you. I appreciate your comments.
Thank you for hearing me.
Okay, thank you. That brings us to the end of the deputation. So we'll now invite questions of staff. Questions of staff. Councillor Cressy.
Thanks. So to the medical officer of health, it's a question I posed to the representative from CAMH, but to you and your report, what are the harms associated with the criminalization approach that has been in place for the last century that from a public health perspective you think need to be mitigated?
Those harms are not laid out in any detail in this report because that wasn't the position that we took. But broadly speaking, I would agree with the description of harms that was outlined by the deputant.
Which are?
Well, really unnecessary criminalization of individual behavior, a failure to address the harms arising from the substance itself, in other words, availability to youth and so forth. And I think, generally speaking, an inappropriate use of resources.
So a legal regulatory approach that we've talked about in the report would mitigate and remove those harms of criminalization?
Yes, it would.
Okay. Now, in the report you spoke about some of the harms associated with the recreational, non-medical use of cannabis that you'd be looking to mitigate through a framework. What are some of those harms? I understand that one of the recommendations is for a great deal more research. One of the deputants spoke about the lack of research for occasional use. But from what we know and the evidence you've presented and seen, what are some of the harms we're seeking to mitigate? You refer to cannabis being, in a recreational context, not a benign substance, I believe were your words.
That's correct. No, the evidence that we do have, and acknowledging that there are many areas where more evidence would be helpful, probably the most significant public health finding actually has to do with the interaction between cannabis use and driving. So that's listed in the report. There is also evidence of negative impacts on pregnancy, negative impacts on respiratory health, particularly with heavy or chronic use. There is a small risk of dependence. There are links between particularly heavy and chronic use and mental health outcomes, both in terms of developmental as well as mental illness.
Okay. So would it be fair to say that a regulated legal framework would remove the harms of criminalization while mitigating some of the harms associated with the non-medical use?
Yes, a public health approach to regulation would seek to minimize the harms associated with the use of a legal substance, similar to the approaches which have been taken with varying degrees of success with alcohol and tobacco.
Okay. So as the city's medical officer of health, our top doctor, is it your opinion that a legal regulatory approach is the best policy for cannabis?
Yes, a public health-oriented legal regulatory approach.
All right. Now, are there any negative health impacts then if the current criminal approach towards non-medical cannabis continues for another year? If we've identified and you've said that there are harms associated with criminalization, and we recognize that we can mitigate those harms through a public health approach, are there not negative health impacts if we continue with a federal criminal approach for another year?
I'm just reacting to the one-year time frame because I think these are complex transitions. But in general, yeah, if I would take the view that a public health approach is going to be more effective at mitigating the harms that we know are associated with the use of what is the most commonly used currently, illegal drug. The longer we delay putting that in place, the longer we forego the improvement in harm reduction.
Thank you very much.
Thank you. Other questions? I have a couple of questions related to a question that I asked the deputant, and that is the division of legal labor here. The way I'm viewing it, and finding your report, of course, very helpful in that regard, and comparing it to other debates that we have had, and maybe not picking on the smoking one, but picking on the pesticide one. The way I understand it is the feds decide that a product is legal or illegal. They go through their due processes. The province then will decide on the distribution mechanism, and then our role will be to decide on how old, or unless the feds or the province decides that piece. Ours will be to decide how it's used in the community context. Can you perhaps speak to that? Do I have it right, and maybe you can elaborate on it as well?
Well, there are areas of jurisdiction which differ between for purposes of this debate, 3 levels of government. So, for example, you're correct that land use planning is generally implemented at the local level, although the province does set a framework for that. There seem to be, in this area, to be exceptions. So, for example, when it comes to the topic which is not on the agenda today, medical cannabis, the federal government has chosen to reach down and regulate quite specifically in terms of how it's distributed, how it's produced. So I think there is some variation in terms of legal jurisdiction, but broadly speaking, you're right, the different levels of government have different roles.
So one of the pieces that we might be helpful at with our City Hall is to identify that you might be thinking of these kinds of things, which your report does, when we consider, say, land use planning.
Yes, the aspects of regulation which the report has recommended to mitigate harm, some of those are clearly in the local municipal arena.
Right. And just because one of the deputants raised the issue, at the end of the day, this report is not endorsing or not endorsing the legalization of cannabis. Is that your position as the medical officer of health?
Well, that's correct. The report makes recommendations for implementation, given that the federal government has already signaled its policy direction towards legalization and regulation.
But we are not, through this, endorsing the legalization. Not that we're not endorsing the legalization. We are mute on that point.
It's not included in the recommendations, is fair to say.
Right. And we have not, certainly, I've been on the board a few times. To my knowledge, we have not actually taken a position on the legalization, have we? Or the decriminalization piece.
Way back.
Have we?
Way back, I think, yeah. Yes, thank you. I was just looking for the date. The board's decision history on this is cited in the report, and I was looking for how far back it was. It's been some time since the board spoke out on this.
And our position today on that big issue is decriminalization is where we're at. Is that fair? I'm just looking for the reference here.
The report focuses on, in the context of a federal policy direction for legalization and regulation, how can we best do that in order to minimize public health harm? That's really the focus of the report.
Okay, thank you. Other questions? Trustee Glover.
Okay. Yes, I was really intrigued with the deputant Matthias and what he brought up in terms of one of the impacts of this will be that people who are currently selling drugs illegally will lose their source of income. are the people who, do we have any research or do we know if the people who are currently selling drugs illegally are disproportionately in low-income communities in the city?
Probably depends on where they are in the illegal market, whether they experience a low income or not. But no, I think that it probably, and this is not the subject of the report, but I would assume that people who are disadvantaged in a variety of different ways, including by a low income, are overrepresented in a variety of illegal activities, often because that's the only option open to them.
Right, and so I am concerned about the impact that would have. I read a while ago when California was having a referendum on legalizing marijuana that they calculated the cost savings at $4 billion in terms of savings to police and enforcement and jail time, and also the money that would be generated through taxation. So it seems like there will be, I don't know what it'll be across Canada or in Toronto, but there seems like there will be savings and the opportunity to generate some revenue. Is there a history or is there a record of that kind of money going towards supporting communities that are going to lose a source of income or supporting low-income communities? Or is there, I guess I'm having a little trouble phrasing my question, but is there a way that we could recommend, that the Board of Health could recommend, that some of that money be directed to support low-income communities, especially those that may lose a source of income?
Well, the short answer, I think, is yes, the board could make such a recommendation. The number of jurisdictions that have actually completed a transition to legalization are relatively few around the world, as the report points out. So I'm not sure that there are any examples. I'm just looking to colleagues to see if there are any working examples where that has been part of the policy framework moving forward. However, it has been a traditional role of governments to provide social and financial supports as well as to foster economic activity and opportunities for people who are disadvantaged. So I don't think it differs from that traditional government role, regardless of whether we're talking about legalization or not.
Right. It's just, it's going to leave a bit of a void, I think, if that source of income is lost. So anyways, those are my questions. I'll leave that for now. Thank you.
You may want to turn around, and if there's a motion percolating, Susan's right behind you, just so you know. Okay, are there any other questions? Councillor Doucette?
Just to clarify, why did this report come forward? This hasn't been requested of you in the last few months since the federal government has said this. Why did this report come forward to us now? And why were we looking at the non-medical cannabis in this report and not medical cannabis?
Well, the report was requested in 2015 following the issue having been raised by the Drug Strategy Implementation Panel. That was prior to the election of the federal government and the change in policy at the federal level, and it was also, of course, prior to recent enforcement activities. So this report really came from a very different context than we have today. Having said that, I believe the recommendations in it are still appropriate and relevant for the coming change at the federal level.
Thank you very much.
Great, okay, thank you. Speakers, Councillor Cressy, Chair of the Drug Strategy.
Thank you. I'm going to start with moving a motion. If it can be put on the screen, it's being advance circulated. This comes from the Toronto Drug Strategy Implementation Panel, that the Board of Health urged the Government of Canada to provide immediate interim guidance on how municipalities should approach the possession and sale of non-medical cannabis using a public health approach prior to the forthcoming legalization and regulation in 2017. I want to thank staff for their hard work in preparing this report. And building on Councillor Doucette's questions there, to those in the audience who are wondering, the reason this report is here today is because we requested it more than a year ago, that we proactively as a board said what are the type of regulatory frameworks from a public health approach that we should consider with cannabis. That's why this is here and that's why it's thorough, is because we as a board proactively took steps on this more than a year ago. These days, everybody is talking about pot. The Prime Minister is talking about pending legalization. Of course, people who ingest, vape, smoke, use pot are talking about it. The Mayor's talking about it. The Chief's talking about it. We're all talking about it. We need a fundamental shift in discourse away from a failed criminal approach towards a public health approach. That's what we need to do. A legal regulatory framework is needed. And I'll be very clear, as I always am, I fully support the legalization of pot. The challenge now is to get it right and to make sure we do that. The war on drugs has failed. It doesn't act as a deterrent, we know that. $1.2 billion is spent annually to enforce the law. It has a negative impact on individuals, families, and communities. In fact, 500,000 Canadians, 500,000 Canadians, are carrying a criminal record for the offense of possession. And far too often, it disproportionately affects marginalized communities. Criminalization does not work. Now, cannabis, as we know, has important medical benefits, really important medical benefits. Everybody should have the right to medicinal marijuana if they need it, everybody. And in fact, as the courts have said, and we all know, that needs to be improved. That access needs to be improved. But what we're dealing with here today as it relates to non-medicinal cannabis, recreational, is that we also have to understand in designing a public health-based regulatory approach that there are also harmful consequences of recreational use if it's not used properly. And in fact, a lot more research is needed into this. So it's not benign. So like tobacco, we need to look at the respiratory impacts. For young people, we need to understand better what the cognitive impact is. Certainly for driving. These are not benign impacts. That's why we need good regulatory frameworks. Now, a public health approach, as we've heard, has a number of important considerations. And here we are as a Board of Health debating what are those types of approaches that we think the federal government needs to consider as it relates to distribution, access, content, age appropriateness, pricing, marketing, driving, and public education of the risks. We need to do this thoughtfully. Drug use is complex. Drug policy, therefore, also must be complex. We need to get the balance right. If you over-regulate, you continue an illicit market without the same quality control. If you under-regulate, well, then you normalize a behavior which we know has consequences. So you need to get the balance right. But where we stand today, and I want to be very clear, in our motion from the Toronto Drug Strategy Implementation Panel speaks to this, is that despite the really positive indications that we're going to have an evidence-based public health approach to pot in 2017, as it stands today, the federal government today has let us down. We have been told by the federal government that criminalization doesn't work, so tomorrow we're going to solve it. But today, you have to continue to enforce it. That doesn't work. The approach needs to be adjusted, and municipalities need guidance today. This isn't Toronto on its own. Municipalities right across the country are struggling with a vacuum. We're in legislative limbo. And we cannot have a public health scenario where some municipalities are implementing bylaws, some municipalities are cracking down on possession, some municipalities are doing nothing. That's not a good public health approach. If public health is the overarching framework, then an interim guidance and interim measures based on public health are required. It's time to move to a legal regulatory framework. It's time for the Board of Health to state clearly that a public health approach is the way to do it, and the task now is to get it right. Thank you.
Thank you, Councillor Cressy. Other speakers? I know Stacey has a motion. I'll let Stacey go, and then Councillor Doucette.
Okay, good afternoon. My motion is pretty simple. It's just an amendment to recommendation 4 to also forward this report to the provincial and federal ministries of transportation. And Councillor Cressy did indicate that there is a key public health concern as it relates to drivers. In terms of the use of cannabis while they're driving. Although the report does indicate that there's some inconsistencies with the effects of cannabis while driving and it's still not well understood, it is important that we keep the federal and provincial ministries of transportation updated with this report so that this key public health concern of driver safety can be addressed.
Thank you very much. Very helpful motion. Councillor Doucette to speak.
Thank you very much. I did want to ask, as I asked the question about when and why this report is here today, I don't know if everyone did read that first paragraph in the report. I wanted people to be clear about when we around this table started thinking about this. So now that the federal government has said sometime in maybe the spring of 2017, you're correct. We as a municipality have to get our ducks in a line, so to speak. But as a Board of Health, we have to look at this from a health aspect. As I said earlier, I have learned so much in the last few weeks and months, and I appreciate people who have spoken to me. I know we're not talking about medical marijuana today, but I think that, and the federal government has to look at that part. I do believe it helps people. I do believe it has medicinal reasons and things. I do believe that. But what we're talking about today is how to regulate to help on the health side of a recreational use. I support the report in front of us because these are the sort of outlines, the guidelines we've taken when we're looking at tobacco, when we're looking at alcohol. So I don't think we're looking at this in any different way. I truly hope we do have an age limit because a lot of young people don't understand that smoking cannabis does have health impacts on them. We've gone through this in Board of Health when they're smoking the hookahs. They say, oh, it's safe, it's safe. It's not 100% safe. Smoking pot isn't 100% safe. So people who are going to smoke it have to be educated and have to understand what they're doing to themselves and also what they're doing to those around them with a secondhand smoke. So this is why this is suggestions to the federal government. I hope they listen to us. The Toronto Board of Health does guide the way in so many different areas. We've mentioned, the chair mentioned some today. So I do support this. I think we do need some restrictions. I think one of the important things to me is to make sure the product out on the street is safe as can be, that everyone understands what they're doing to their bodies by using it, whether it's smoking, ingesting, rubbing, all the different forms there are. One other thing I would like, and I know it's not quite here today, and I am probably overstepping my mark, the government, and both governments, the province and the federal government, have to also work with our doctors so they know how to do a proper prescription when they're doing a medical marijuana. That's not before us today, so I'll stop on that. So as I say, I do support this. It is a step forward. I think we do have to tell the federal government what they should be doing. I think they have left us all hanging in a very, very grey area. And I think they should move their little derrieres and get this going as quickly as they can. Thank you.
Thank you very much, Councillor Doucette. Seeing that Trustee Glover is still kind of working on it, maybe I'll speak, or do you want to go? Yeah, and then I'll give you a few more minutes. Great, thank you. I too want to thank staff for this report. It is so well written. And you know, I have an eye for bias. I try to have an eye for bias in reading these kinds of reports, and I found it to be so thoughtful, and it did not bring any moralisms to it. It did not bring any assumptions that at least I could perceive. So I really thank you, Susan, for. Julie, you're a good writer, and this is testament to that. And another thing that certainly I found in reading it is in the scan of literature. It is good. I found I learned a lot. I did not know that smoking cannabis has a different impact on how you drive than alcohol. And, you know, these are the nuances of this conversation that are really going to be important when the final regulations that we will have control of as City Hall are going to be put into place. So I think, and I think our appeals, when they start to do hearings at the federal and perhaps the provincial level on the issue, that we're going to have a good basis to be making strong recommendations as a health unit. So I think this kind of science-based, scan of literature-based, best practices-based approach that we're applying here is going to serve all of us well. I do think we are, as Councillor Cressy mentioned, in a paradigm shift. We are moving from, call it a punitive criminal justice mode of understanding cannabis to a public health mode. That's a cultural transition. That's a deep cultural transition. We've gone through that transition before. We went through it with the temperance movement just slightly less than 100 years ago today to a more public health approach that we use now. And so we're doing that with this particular product. And it's going to take a little bit of getting used to, and we are in that limbo period. We are in that in-between paradigm period. And yes, some might think the police acted too strongly. Some may think that that's the law is the law, and they have to apply the law as they see it. Well, that's really, thankfully, that's an interregnum period. We will get this right. And yes, we have to suffer through some things in this period while we're working it out. But I think it's good for us to see that really what we're about in terms of larger social processes is this paradigm shift from one way of viewing it to another way. And we think we're going to have a healthier community once we move to another way of looking at it. And I hope, even with the conflicts that we have now, that we keep our eye on the ball. The ball is really going to start to roll out rather quickly as 2017 comes along. What I view this report as is the beginning of the conversation on the how. How is cannabis going to be distributed? How are we going to make sure that the product is a product that isn't laced with inappropriate substances? How do we approach education? How do we approach driving and cannabis use? How do we approach age limitations? All of those are going to be very, very serious questions. We've got to get all those questions right as legislators at all three orders of government. And so this is the beginning of the conversation, and really, to me, the test is, does this start a good conversation? I think it does. I think it does. I think this report gives us some good idea on the kinds of issues that we need to struggle with in the days and in the months ahead. From the deputation, I can't remember the gentleman who made the point, we need to start educating folks. And so I do have a motion that urges the staff to begin that broader education process as soon as possible so that we have a broad base of knowledge, real knowledge in the community that will serve a conversation. So I think it was Matthias who made that recommendation. Okay, so those are my comments, and now Trustee Glover.
Yeah, I'd like to echo the comments about the report. I thought it was incredibly easy to read and well organized, and it gave us a very quick but comprehensive overview of the issues. Based on the comments, and I think it does speak to the value of deputations, this committee has discussed many times the poverty as a key determinant of health. And I think that, one of the unintended consequences here is that we will be depriving some people of a source of income. So I've drafted up this motion, and I thank staff for helping me put it together very quickly, but it basically says that the Board of Health urge the Federal Minister of Health to earmark some of the savings and tax revenue generated from the legalization of cannabis towards low-income communities, particularly those affected by the unintended consequences of legalization. Earlier, I quoted the $4 billion that was calculated in California. California has roughly the same population as Canada. I don't think our savings will be $4 billion because we haven't had a rather ill-advised war on drugs, so we don't have nearly the incarceration rate. But I think there will be some savings and some money, and it would be great if at least a portion of that was earmarked to those communities.
Okay. Hey, thank you. Anybody else? Thank you. Great conversation. So we'll go through the motions. Thank you very much, Nancy, for putting them in such a good order. The first motion is by Councillor Cressy. You have it before you. All in favor? Recorded vote. Okay. Trustee Glover, Councillor Carmichael Greb, Stacey Berry, Councillor Doucette, Councillor Mahevik, Councillor Cressy, Councillor Nunziata, and Peter Wong. All in favor? That passes unanimously. Number 2, that recommendation 4 be amended to also forward the report to the provincial and federal ministries of transportation. Need any recorded vote? Probably not. Okay, all in favor? Opposed, if any? That's carried. Number 3, that the Medical Officer of Health be requested to begin an education campaign. All in favor? Opposed, if any? That's carried. And lastly, not lastly, but the last amendment, that the Board of Health urge the Federal Minister of Health to earmark some of the savings. All in favor? Opposed? That carries in the majority. And now the motion as amended. All in favor? Record this. Peter Wong, Councillor Nunziata, Councillor Cressy, Councillor Mihevik, Councillor Doucette, Stacey Berry, Councillor Carmichael Greb, Trustee Glover. In favor, and of course then none opposed. Thank you very much, everyone. This was a good discussion. I thank you for your attention and for your courteousness in making your presentations. Thank you. Yes, so we'll just take literally a 2-minute pause to allow people who want to leave. We have another big item on, so hang in there if you're waiting to depute, and we'll allow the others to leave. Okay, folks, we're going to get started again.
Make sure that Trustee Glover's motion, that it's recorded that Carmichael Greb and myself voted against it. You did? Yes. Yes.
You didn't ask, but is that possible?
Sorry, we did vote against it.
Yeah, you voted against it.
Oh, sorry. Yes, it was not a recorded vote. We want to make sure it's recorded. We don't record it. No, but I mean, that it says it's not a recorded vote, but you could put that Council Carmichael Greb voted against.
I can't do it without opening. I can't do it without the.
Because we voted against it.
Yeah, I know, but you should have asked for a recorded vote.
Well,
That's the process. Okay. 1, 2, 3, 4, 5. I'm going to invite Board of Health members back to their chairs. Councillor Carmichael Greb. And Councillor Nunziata. Okay. Are you staying in? Four. This is 20 to 4.
Yeah, I know, but you got.
Councillor.
No, but look at all the deputations.
Okay, thank you very much. We're hanging on to bare quorum, so we're going to need to be disciplined, folks. And I noticed that the next item does have about 6, 7 deputants. So just if you could keep that in mind, that would be, frankly, very helpful. So the next issue is Chemtrack Pollution Prevention Partnerships. I have a number of deputants, no presentation. First two are Colleen Cushman and Heather Marshall from the Toronto Environmental Alliance. You're going to be speaking together? Separate together, okay.
So thank you for the opportunity to speak. My name is Jolene Cushman, and I work with the Toronto Environmental Alliance. T has been working in Toronto since 1988, and we have over 60,000 members in Toronto. We were pleased to be participating in stakeholder conversations in advance of the staff report on pollution prevention in the dry cleaning sector. We were able to share a lot of the insights and findings that came from our Coming Clean, Going Green project, which was made possible with funding from the Live Green Toronto Chemtrack Toxic Reduction Grant. So I'd like to share a bit about that project with you today. We started this project because highly toxic chemicals like PERC are still widely used in Toronto, despite being on the list of the top 25 toxics in Toronto. So-called alternatives, chemical solvents that have been entering the market, still have very serious environmental and health impacts. And finally, there isn't a lot of public understanding around wet cleaning, a toxic-free alternative to dry cleaning. So as a part of this grant, we developed a scorecard for these chemical solvents used in dry cleaning, engaged dry cleaners about the environmental and health impacts of these chemicals, and created a directory of toxic-free wet cleaners. Additionally, in collaboration with Environmental Defense, we translated information from the scorecard into a consumer resource in the form of a pocket-sized guide to non-toxic dry cleaning. So up on the screen there is our scorecard. You can see the chemical names listed, and below that, the trade names that some of these go by, like Green Earth or EcoSolve. So this scorecard was used by consumers, along with T supporters and volunteers, to collect data on what process local dry cleaners were using to clean clothes. The scorecard has 6 chemical solvents listed, along with toxic-free wet cleaning. Based on our engagement with dry cleaners and associations, we learned a commonly spoken language among dry cleaners in Toronto was Korean, and so we translated the scorecard and our outreach materials into Korean, and also were able to engage people who wanted to speak in that language face-to-face. So with the help of a placement student from Big Master's Labor Studies program, we're able to collect additional data by actually going and visiting dry cleaners and speaking to them in person. So in addition to our work on toxics and dry cleaning, we visited and interviewed wet cleaners in Toronto whose cleaning process involves no toxic chemical solvents. So I did have a short video to show, but unfortunately we're having technical difficulties.
And we're also having difficulties with the viewer.
Is it too much light? Is that what you're... It's too strong, the light? Yeah. There you go. You just have to say it, and somehow the gods just kind of... Great, that's it? Both of you?
That's it for me. Unfortunately, I did have a video to show that showed the wet cleaning process, but we had some issues.
Great, okay, so Heather, up to you. Over to you.
So as a new speaker, though.
As a new speaker. I was going to give you 10 for 2, but...
All right. Well, good afternoon to the members of the Board of Health, the city staff, and the visitors here today. My name is Heather Marshall, and I'm the Campaigns Director at Toronto Environmental Alliance. As my colleague Jolene just shared, T has been working with the dry cleaning sector on pollution prevention efforts for nearly 2 years. And I'm here with you today to do two things. First, I want to express my organization's strong support for all three recommendations put forward by staff in this pollution prevention report. And second, I want to share a few ideas about how we can go further to protect public health from harmful chemical solvents found in our air, our water, and even in our clothes. So Toronto Environmental Alliance does support Toronto Public Health's recommendations. Number one, it is very important to continue developing pollution prevention partnerships with the various business sectors that have been using and releasing chemicals that pose risks to our health. We've seen firsthand by participating in the dry cleaning stakeholder meetings how the wealth of knowledge in this industry can lead to some very constructive solutions. Second, updating the dry cleaning curriculum at the provincial level to include new information about the benefits of wet cleaning is an effective and simple way to raise awareness and hopefully encourage dry cleaners to invest in their health and their business when deciding to replace their old PERC equipment. And what we hear is that many will be replacing their equipment in the coming years, so it's an important time to make a good business decision. Third, for environmental procurement, we think it is a great way for the City of Toronto to lead by example. This recommendation to prioritize wet cleaning can ensure that workers who benefit from these contracts are also benefiting from a safe and healthy workplace. And now I'd like to share a few suggestions on how to further advance pollution prevention in our city this coming year. The first recommendation is that since Toronto Water is working on pollution prevention within the 5 sectors highlighted in this report already, we recommend that any solvents or other chemicals with health or environmental risks be included in Toronto's sewers bylaw so that chemicals entering the drains or potentially entering the drains are properly managed and do not end up contaminating our buildings, our groundwater, and impacting Lake Ontario. This recommendation is based on our experience working with the dry cleaning sector for the last year. Aside from PERC, other dry cleaning solvents like hydrocarbons and siloxanes, as mentioned in this scorecard, may not be adequately managed in our sewer system, and there is evidence that they can harm aquatic life and contaminate our water. Our other recommendation relates to increasing consumer awareness about toxic chemicals used by dry cleaners. Consumers visiting dry cleaning establishments are often faced with marketing claims like organic dry cleaning and eco-friendly, even though many of these cleaners are using PERC and other toxic solvents. Our research showed that many of these solvents that you see in yellow do indeed have some possible impacts on the aquatic life and on people's health, and they haven't been as heavily regulated as substances like PERC, which Jolene mentioned, have been deemed toxic for quite some time. One thing that we learned from our Coming Clean Going Green project was that people want a simple and easy way to get information about dry cleaning solvents. Our wet cleaner directory and the map of PERC cleaners that we developed were successful in educating consumers. On the flip side, something like our scorecard, which they'd have to bring to the cleaners, or programs like the ChemTrack website, are a little bit less successful in this regard. Toronto's ChemTrack program is great at collecting data on chemicals used by dry cleaners and makes this information publicly available through an online database and an interactive map. The challenge is that consumers must proactively seek out the information about these chemicals. Most people will not do this before making a purchase. They want clear information about what options are good for their health and the environment at the point of sale. Other jurisdictions like New York City also have a right-to-know legislation, much like ChemTrack in Toronto, but they're using additional measures such as point-of-sale displays to ensure that consumers can make an informed choice and reduce their potential exposure to chemicals. Going forward, we believe more can and should be done to increase consumer engagement on the toxic hazards in dry cleaning solvents. Consumers, dry cleaning workers, and community members have a right to know which chemicals are being used by dry cleaning shops so they can protect themselves from any potential health risks. Ultimately, the goal of Toronto's ChemTrack program is to reduce chemical exposure and to reduce the related health risks by engaging businesses in pollution prevention efforts and informing the public of the risks so they can make informed choices. A display program will bring community right to know down to the street level where consumers are making decisions on a daily basis. We strongly recommend that the Board of Health pass a recommendation to investigate and implement a solvent display program like New York City. It could be a window display program so that consumers and workers have a right to know which chemicals are being used by these services. We believe Toronto Public Health could establish something similar to Dine Safe or Body Safe, if you're familiar with those programs, but for the dry cleaning sector. That's just one idea that's come up in the business. This is an example
If you could wrap it up too, sorry.
Sure. This is an example just on the request of wet cleaners that we've been working with in the City of Toronto, where we experimented with a window display program during our Come and Clean Going Green project, and we found it was very successful with them. It was a way to show consumers what they were using, which was a toxic-free wet cleaning process. Thanks.
Great. Thank you very much. Questions? Councillor Doucette.
Thank you very much. So in the report before us, Board of Health is looking at benefits from auto body paint and repair, dry cleaners, fabricated metal. Why did T come up with looking at the dry cleaners?
We've focused on dry cleaners because there are many chemical solvents that public health deals with, and tetrachloroethylene, also known as PERC or perchloroethylene, is one of the 8 substances public health deemed last year and the year before as one of the top chemicals of concern to public health. There was only 8 on that list, down from the 25 that they regulate. And PERC was one of the ones on that list. PERC is only really used in one sector, which is the dry cleaning sector. The other chemicals that they've been looking at are used by a wide variety of sectors, and of course each sector is going to be different in the way that they deal with those chemicals, and the way they would adopt new technologies or do pollution prevention would be different. So this was a very clean, pardon the pun, example where we could really focus in on a sector and really help them transition to alternatives that are a lot better for their health and the environment.
And your request to monitor through public water, through Toronto Water, because if I'm assuming we are saying that if we stop dry cleaners using PERC, I'm going to use it short term, the short name PERC, if they move to other chemicals, unless we're testing for those other chemicals, we won't know what they're using. Is that sort of why you're wanting us to test other substances in the water?
That's right. With the sewers bylaw, there's a number of subject pollutants that are measured and monitored, and companies have to develop pollution prevention plans for those substances. Dry cleaners using PERC do have to develop pollution prevention plans through Toronto Water. But when you look at the pollution prevention plan form, it doesn't really ask a lot about other types of solvents that they may be transitioning to or using in addition to or apart from PERC. And what we've been learning from our research and drawing on the Toxic Use Reduction Institute from Massachusetts and their scientific panel is that some of these other solvents that are emerging in the industry have not been as rigorously tested, and some of the scientific evidence is showing that there could be harm to aquatic life and to health. So it's time to play catch up a little bit, and the sewers bylaw is one of those examples where we are opening it up for review right now, to look at any emerging chemicals of concern that we're finding in Lake Ontario and the Great Lakes. And siloxane is one example that has been found in Lake Ontario fish, for example.
So I'm just trying to get this, our stepping stones. So we don't want them using PERT. We don't really want them going to just a different chemical, which still has issues with our environment. You mentioned wet cleaning. Is that the most environmentally friendly? And when you go to dry cleaning, you're now saying wet cleaning. Can you just, how does that help the environment?
Sure. Certainly the wet cleaner, I know there's some wet cleaners who will be speaking after me, and they would be the best to answer it. They live and breathe it every day. But my short answer to that is that they can wet clean most dry clean only, if not all dry clean only items, and they're using really specialized machines that can control humidity, moisture, and how rigorous they move the garments around. They're using special detergents, and then they're using special finishing equipment instead of using PERC or other solvents. The reality with dry cleaning is that dry cleaning is not actually dry. You do soak the garment in chemicals. So the question is, you could soak it in solvents, or you could soak it in a water and detergent base. Either way, it is going to get wet, and then is going to be dried properly by a professional. What we want to see is that we don't want to see as much regrettable substitution. It's something we see very, very often in dealing with chemicals in our communities, is that something is painted as really bad and people move to the thing that's less bad. And then science, shows us years later that, oh, that thing that was less bad is actually still pretty bad. We, in this industry at least, have a really clear signal that wet cleaning passes all the tests as far as water issues, air quality emissions, and any issues concerning health. And that's been scientifically monitored by the Toxic Use Reduction Institute in Massachusetts. So that's where we're basing our information on, and they've proven that wet cleaning is indeed the most environmentally and health-based the best option out there.
I have one last very quick question. The people who actually work in these dry cleaners, we often look at, what the chemical ends up in our water, our air, and our soil, but the people who actually work in these dry cleaners, this PERT, it really smells, doesn't it? And therefore, are we going to make them a lot healthier people in their work environment as well?
Certainly with solvents, there's a lot more risks, for health concerns, and there are protocols that can be put in place to avoid, some of those health issues, but it's still a hazard. It still requires very, very careful processes. And yes, women, especially who are working in dry cleaning industry, are more at risk. And what we've learned from our research is that many of the dry cleaning companies in Toronto are folks that are Korean-based family businesses. English may or may not be their first language, and therefore they're not only trying to come to grips with a variety of challenges that they're having language-wise, they may also not be accessing information in their language about the risks of these solvents. And so we do definitely see the health concerns for workers as a key component of this, and also the health of people who are tenants living above or beside these buildings. We know these buildings who've used PERC improperly in past years have had contamination issues, and we know in New York, part of the reason why they stepped up their game with a display program and a phase-out even of PERC-based cleaners in these co-located buildings was because of concerns of public health. People were actually breathing out PERC in respiratory tests, and these are people who were living above a dry cleaner. And so there was a serious concern for tenants as well as workers.
Thank you very much.
Thank you. Very good presentation. Next is any further questions? Okay, seeing none. Paul Mercer, Echo Pure Cleaners, followed by Dino Cansavelos. Welcome, Paul.
My name is Paul Mercer, and I'm with a company called Eco Pure Cleaners. We are a wet cleaner, one of very, very few within the city of Toronto. We do have one retail facility on Mount Pleasant. The company has been in business just over 10 years. I myself have only been associated with the company as an employee for a year, but I've known the two owners for over 25 years, and hardworking people, and I just want to share a quick picture with you because I'm here today because they couldn't be here today because they have a business to run. And we don't have a large business at all, but on the left is Tom Tran and his sister, Hoa La, and they are the co-owners of Eco Pure Cleaners. And I just wanted to share that photo with you, but also to share a little bit about why we're wet cleaners as opposed to dry cleaners. And it really goes back to the history of the family. So this particular family fled Vietnam in 1980, and through a circuitous route was able to get here and eventually to London and then subsequently to Toronto. And when they got established here, Tom and Hoa's mom, having to support 6 children because her husband was still incarcerated back in Vietnam, decided that she had to do something, and she got into the dry cleaning business. Had no experience at it at all, but got into it and worked very, very hard, like a lot of people in that situation. And over a period of time, established herself well enough to be able to buy that business. And what happens in a lot of families like this is your employees are your kids. And so out of the 6 children that she had, 4 of them ended up working at various times in this business. This was a PERC establishment. This was back in 1980, and she carried that on until just about 2000. So she herself worked in that for 20 years, and her children at various times throughout there and for various hours, I guess on a weekly basis, did as well. It was around the end of 1990s that information started coming out about PERC and about some of the hazards of it. Primarily that, more so than any other chemical, I guess. And that was the time that Tom and Hoa's mom sold the business and then moved on. But as I said, at that point, she'd been established and worked there for 20 years. She subsequently died in 2011, liver cancer, and while it could never ever be proven, there certainly are reports that there's a direct link to continued and sustained exposure to PERC and liver cancer. But so, long story to get there, but the reason is that Tom and Hoa and their brother Alex, an older brother, established wet cleaners. Alex did that in 2012. And Tom and Hoa, I'm sorry, in 2002, and Tom and Hoa in 2005. So we're somewhat in the industry. These two companies are known as the wet cleaning family, basically. As I said, I'm relatively new to it, and when I started just about a year ago, I did a lot of research trying to find out what wet cleaning was and what dry cleaning was. And as we just heard Heather say, and a lot of times when I've spread this news to people, they had no idea that when they took their clothes to a dry cleaner, they actually got wet. And as we know now, that absolutely is the case. You have a choice. You can get them wet in chemicals, or you can get them wet in water and biodegradable soap. And that's really what we use at EcoPure. And I think the rest of the wet cleaners probably do that as well. In my research, I found out about tea and got a lot of information from them, and found out about the scorecard that we saw that was put up there previously by Heather. And I think I need to turn one of these off, do I? Probably.
A little sideways, I think, as well.
There we go. Okay. So we were given a window display by EcoPure because we are a wet cleaner, and they go ahead and recognize us. And it's this what we see up on display right now, and it basically is their scorecard. So what we were doing is, in our marketing material, we decided to have some door hangers, and obviously we're here to get more business, and we have our blurb on the front of it and whatnot, and rather than putting more of us on the back of it, we put the scorecard, basically. And we distributed over 15,000 of these in our local area on 3 different distributions, and basically just hung them on the doors. Our business has increased, which is the good news part of it, but the remarkable part is that people come in who were our customers already, and then some new customers, with this in their hand and wanting to know what's all this about? What are these other chemicals that are listed here, and why didn't I know about this prior to now? And also, why is it a company like you that's really having to disseminate this information to us? So we do our best to go ahead and spread that news, but I think what it leads us to here is the fact that there's an awareness that's needed. There is a lack of awareness out there right now about wet cleaning and about the chemicals that are being used. And while we know that when we applaud the City of Toronto for establishing the chemical tracking system, ChemTrack's goal is to protect the public health and disclosure of identified chemicals to the public.
Paul, I'm going to ask you to just wrap it right up with your one last sentence.
All right, one last sentence, okay.
I was distracted by other sounds.
Okay, I'm sorry about that.
Should have caught it earlier.
My major point is to endorse a fact of a point-of-sale display. And I think this is needed. It allows the people that are coming into that facility to go ahead and determine what type of chemicals are there or not. And it's not a large step for the City of Toronto to go ahead and make that, because we already have Dine Safe as well.
Okay, thank you very much. Any questions? Seeing none, that was very helpful, putting a human face on this. Next is Dino Cancevelos. He canceled? Oh, okay. Sydney Chelsky, Ontario Fabricare Association. Welcome, Sydney.
Thank you. My name is Sydney Chelsky. I am the Executive Director of the Ontario Fabricare Association. Our members are located throughout the GTA as well as throughout the province of Ontario. Our association was previously known as the Dry Cleaners and Launders Institute of Ontario, the DCLI. Our membership is made up of the leading dry and wet cleaning operators in the province, and we provide continuing education to our members, including environmental safety for our employees, our customers, and the public. Our members have been involved in Environment Canada's Green Clean Project October 1995 and work in partnership with Seneca College in the continuing education and environmental certification of dry cleaning operators throughout the province. Our association is currently working with the Ontario Ministry of the Environment in achieving self-regulation of the industry, and our association will oversee this project. In addition, we will provide annual inspections of every cleaning plant in Ontario, including those in the GTA. Our mandate will be to inspect plants using all solvents that are being used and to ensure that they are being used in a safe manner. Many in our industry have started the process to offer wet cleaning services. As pioneers in the industry, they have spent hundreds of thousands of dollars in equipment upgrades. Regardless of what the equipment and detergent manufacturers state, not all garments can or should be wet cleaned. There are ramifications to recommending that dry cleaners change to wet cleaning only. Garment manufacturers are creating many clothes today that say dry clean only. That means no water. Just after the dry clean project concluded almost 20 years ago, we were excited about wet cleaning everything. Then reality set in. Dry cleaners received garments for dry cleaning. The care label said dry clean only. Wanting to experience the new wet cleaning recommendations, the colors bled and cleaners had to pay the customers thousands of dollars in claims for not following the care instructions on the care label. During the Green Clean project for the first 6 months, 50% of the claims were made for color and dye running, 40% for shrinkage, and 10% for stains and cracking of rubberized coating. The current wet cleaning equipment and detergents available have increased the ability to wet clean safely, but not by 100%. Many in our industry think the number is closer to 90%. Garment manufacturers in North America, including clothing designers, will have to make their garments cleanable in water. This is a daunting task and highly unlikely, since apparel stores and manufacturers are reluctant to recommend wet cleaning. Will an expensive wool suit look better wet cleaned or dry cleaned? The consumer will be the judge. The Federal Trade Commission requires that care labels on garments list a successful method of cleaning, and failure to adhere to the care label instructions can lead to garment damage and financial losses to the cleaner. Government will have to convince apparel manufacturers to produce garments that are serviceable in wet cleaning. In summary, we recommend the best way to reduce solvent consumption in the short term in Toronto, or anywhere for that matter, are for annual inspections to take place to ensure compliance to federal and provincial and municipal regulations. In today's dry cleaning plants, the equipment is environmentally friendly. Most, if not all, the machines are operated on a dry-to-dry cycle, significantly reducing the amount of solvent being released into the atmosphere. Unlike wet cleaning, we do not put solvents and/or detergents down the drain. This will weed out the bad operators. Over the long term, allow for the dry cleaning industry and the technology to catch up to your concerns. If you fail to provide enough time for change, dry cleaners will be forced out of business or forced out of Toronto. Prices for dry cleaning will rise to offset the cost of transportation to service existing locations and purchases of this new equipment, and result in more vehicle congestion and pollution. The Ontario Fabric Care Association supports all attempts to reduce the use of chemicals in the dry cleaning industry and continues to work closely with its members, other associations, and manufacturers to this end. As well, our association stands ready to work in partnership with the City of Toronto in promoting safe methods of cleaning, including wet cleaning. Thank you very much.
Thank you for your presentation. Much appreciated. Are there any questions? Seeing none, we'll move on to Muhannad Malas, Toxic Camp Program Coordinator, Environmental Defense. Welcome.
Dear Board of Health members, visiting counselors, and attendees, my name is Muhannad Malas, and I'm the Toxics Program Coordinator at Environmental Defense. Environmental Defense is a charity organization that conducts research and communications on toxic chemicals of concern in consumer products and the environment, and works with businesses and governments to find solutions that protect the public health. So I would like to thank you for the opportunity to be here today to speak to you about why I support the Medical Officer of Health's recommendations to promote wet cleaning as a strategy to prevent pollution in Toronto's dry cleaning sector. Dry cleaning in Toronto is a source of significant amounts of toxic emissions and environmental pollutants that continue to put the health of many workers and residents at risk. Last year, we published a research report that investigated the economic and environmental health impacts of dry cleaning alternatives in Toronto. Our research concluded that wet cleaning is a safer, environmentally friendly, and economically viable method that does not rely on the use of toxic solvents such as perchloroethylene, or known as PERC. Our research also showed that municipal programs and policies that address misconceptions regarding the effectiveness of wet cleaning, provide support to wet cleaners, and help consumers make more informed decisions about their dry cleaning choices can help to reduce toxic emissions from the dry cleaning sector. So to put this into perspective, I just want to share with you some of the findings of our research. So currently, PERC is the most widely used chemical solvent in Toronto in dry cleaning, and it is a harmful chemical, as has been mentioned in previous deputations, that has been linked to cancer and other conditions, including asthma. The International Agency for Research on Cancer qualifies PERC as probably carcinogenic to humans, and while many U.S. jurisdictions are phasing out PERC, Canadian regulations only deal with the way PERC is handled and reported, but have done very little to phase it out. PERC continues to pollute our air and environment in the City of Toronto. According to Chemtrack data, in 2013, 13 out of 31 tons of PERC that were used were released in emissions, and that was only by 65 dry cleaning businesses. Also, data from the City of Toronto and Ontario's Ministry of Environment and Climate Change demonstrate that PERC usage in Toronto is not decreasing. So according to Ontario's Hazardous Waste Information Network, the amount of waste from PERC has not declined since 2011. Dry cleaners in Toronto produced over 43,000 kilograms of hazardous waste in 2014, and that's PERC dry cleaning. So many dry cleaners are now also using other polluting solvents like hydrocarbons. Emissions from hydrocarbons could contribute to smog if they were released to air. And also silicone-based solvents like siloxane D5 are also becoming popular alternatives. And recently a study showed that siloxane D5 is one of the top 5 contaminants in Lake Ontario fish. And this data came from the Environment and Climate Change Canada. And one of the main problems with these, with some of these alternatives, is that they are marketed falsely as green or as environmentally friendly. Our research also found that most dry cleaning operators are simply not familiar with wet cleaning technology, its health and financial benefits, and the high quality of cleaning that it offers. So for these reasons, it's important that the City of Toronto promotes wet cleaning as a safer and effective alternative. The Medical Officer of Health's recommendations are essential steps that the city can take to help recognize wet cleaning and increase awareness within the sector and among the public. But also, as more consumers demand safer alternatives and more dry cleaners switch away from PERC, it is important to consider programs that help consumers identify and choose environmentally friendly options. So one program that was mentioned in a previous deputation is the point-of-sale display policy that discloses the type and potential hazards of chemical solvents used. And that's already been used in New York City as an example. And a familiar example in Toronto is the food safety program DineSafe, which really helps to disclose a similar type of information to consumers within that industry. So this type of program would help consumers make more informed decisions when they walk into a dry cleaner, and it would address misleading marketing. So I strongly encourage the Board of Health to adopt the recommendations put forward by the Medical Officer of Health to promote wet cleaning in Toronto, and to consider a point-of-sale display program as an approach to recognize wet cleaning, prevent greenwashing and false marketing, and give consumers the right to know how their garments are being cleaned. Thank you very much.
Thank you very much. You were just 5 seconds under. Perfect, wonderful.
Great.
Any questions? Trustee Glover.
So, you know, from what I'm hearing in the deputations, it sounds like there's a need for regulation in the dry cleaning end, but it sounds like it would be even more helpful if there was regulation in the clothing end. Like if the government insisted that clothing that gets sold in Canada could be wet cleaned rather than dry cleaned. Would you agree with that?
So one of the really interesting ideas around how to address misconceptions or misperceptions around dry cleaning and wet cleaning is to really address the fact that many of the labels that come on are attached to clothing say dry clean only when you don't really, you can actually clean it with water and soap. So that's one cause of I guess, misperception, or it's a bit misleading for the public when they read something like that and they become concerned about using something else other than dry cleaning to wash that garment. So there are discussions around in different parts of the world, different jurisdictions around trying to change that specific sort of policy around what goes on that label and who determines what goes on that label.
Okay. I'm just wondering, I mean, would it make a big difference to the clothing that we buy if everything we bought could be wet cleaned? If it was all designed and made of fabric that could be wet cleaned? Like, would we actually notice at the store?
Sorry, I think maybe I misunderstood the question. And,
yeah. I mean, I guess, what you're talking about is one end of the policy.
Right.
But it seems just like at the back end, it's also like we should just have would you agree, and then this will be a question, would you agree that what we should have is a comprehensive policy so that all clothing should be wet cleaned and only wet clean should be done? Like that's what we should be driving towards?
I think, I'm not sure I can agree with the fact that basically that all clothes should be wet clean, you should be able to wet clean them. I think what I can comment on is the fact that wet cleaning has reached a point now where it could be used as a method to clean most sensitive fabrics. And I think from an industry point of view, or the clothing industry, the fact that the industry often promotes dry cleaning as the only way to clean certain fabrics like wool or cashmere, I think that's where the issue is. And I know so Environmental Defense has many supporters, and we do engage with them on different, sort of on social media, for example, on Facebook and Twitter, and many of the comments that we received were that many people are now staying away from fabrics and clothing that say dry clean only because they are concerned about how to clean them. So a lot of people say, I don't buy like a 100% wool sweater anymore because I don't know how to wash it. So there's a bit of concern here. But I think when it comes to wet cleaning, I think a lot of the wet cleaners in Toronto, and based on the experience that we know from conversations with wet cleaners here and also from wet cleaners in the US, they are able to clean a lot of different garments and spot treat as well.
Thank you.
But hopefully, I'm not sure if that provides some answer.
It provides some.
Okay.
Thanks.
Thank you very much. Appreciate your comments. Next is Brian Hatt, and then Karen Buck. Welcome, Brian.
Good afternoon, everybody. I am Brian Hatt with Harco Company, a distributor in the supply of equipment to the dry and wet cleaning industry. I've been in the industry in various capacities since 1981. I'm a certified dry cleaner under the Tradesman Act, did a full apprenticeship many moons ago. I'm an instructor for Seneca College, director of various industry associations, and as some say, the go-to guy in the industry. I've also sat on many committees, as well as the committee that has made the recommendations that are before you today. I have in the past watched the wet cleaning progress to the point that I can say, in my professional opinion, it is the viable option for dry cleaners to use today. The equipment cost is now much less than a dry cleaning machine and eliminates solvents to our air and soil. I congratulate the city departments and those that dedicated their time to this group. I urge you to accept the recommendations and also consider adding support to the Ontario Fabricare Association to offer training seminars for the promotion of wet cleaning as a viable alternative to the cleaning process. And work with the association. Again, you keep hearing this point of sale program that we all looked at on that committee. So to work with the association on the point of sale and visit to review, not inspect, just to review various items in the dry cleaning facilities. This will create a level playing field in the industry. This will help create an accurate database for the city, as all dry cleaners, depots, and coin laundries could be included. This will benefit Chemtrack and Toronto Water as well. The visit will check for a city business license, which could, of course, in turn help generate more income for the city. City water and Chemtrack items, laundry detergents, and natural gas equipment being used. Give the operation a posting of the solvent process being used on garments, and some will have multiple processes. The visit will also look for Ontario certification and federal infractions, potential other items that the city would also like to have covered. This audit would not have the ability to impose fines, but would provide infractions to other departments for further inspections. The one little point that I'll just move along to, that as an industry, we have looked at perchloroethylene, or PERC, being the solvent. And you may be questioning why all of these folks today aren't really even talking about PERC. And I think it's due to the fact that in France and California, as well as New Jersey, they are all phasing out PERC by 2023. In my opinion, and I think we've, in these little committee groups that have popped up, that perchloroethylene will be gone from the dry cleaning industry on its own within the next 10 to 15 years. My theory for that is that the average lifespan of a dry cleaning machine is in the area of 15 to 20 years. So we have not, to my knowledge, there has not been a new PERC dry cleaning machine installed anywhere in Canada in the last 5 years. So PERC, that's why we're no longer looking at, we need to ban PERC. PERC will be gone on its own within the next 10 to 15 years. So I'll move along. And again, thank you to the staff that allow the industry to have input and work together. Thank you.
Well, thank you very much. I have a question. So then the issue of wet cleaning being able to solve running problems and quality kinds of issues around garment care, you think that the wet side of it, so you would somewhat disagree with the two deputants ago saying that wet just doesn't do it?
Several years ago, and I've been an instructor for Seneca College on the environmental certification program. And in those, as the instructor for that program, they do look at a small section of wet cleaning. And I've always said to the industry that, in my opinion, off the record, in my opinion, that wet cleaning can achieve 60% of what a dry cleaner receives over the counter. Today, I will say that that number is I'm going to say 99%. There are certain garments, certain items, when it comes to suedes and leathers and antique satin draperies, they can be definitely still a challenge when it comes to wet cleaning. However, we have the specialists we have the drapery specialists, and we have the suede and leather specialists today that they're doing a great job with those garments.
Appreciate that. My other question very quickly is, and it's only because from just consulting and that some jurisdictions have offered incentives to go away from dry cleaning hardware to wet cleaning machinery.
From a personal point of view, I'd love to see you do that because it will greatly benefit me. Okay. I'm going to be straight with you. It will greatly benefit me.
Let me finish my question, though, because if you're saying being conscious of the dollar as well, you're saying it's going anyway. So now I'm thinking maybe I shouldn't move that, because if we do move that, well, we're not actually going to do it. It would be asking, frankly, the province to do it, that it might not be necessary given the trend in the industry anyway. Your advice?
As I said, so it will greatly benefit me. So I'd love to see you do it. However, realistic and, There is only one taxpayer, and I hate to say this, but my pockets are bare. So my answer is let the industry pan out for itself.
Okay, great, thank you, appreciate your advice. Okay, great, thank you very much. Last deputant for this item is Karen Buck.
Hello again. Anyway, ChemTrack is wonderful. It is a pollution prevention program, and it is looking at alternatives, and that's what we need. And as you've mentioned, there are products on the market that really don't fit into maybe a pollution-free world and a clean world and a healthy world. And so I think that I'm not quite sure if it's ChemTrack that keeps on promoting these things and using models from all over the world, but how are we going to keep on moving forward to keep on dealing with the problems that are still polluting our air or still polluting our water? And as Heather mentioned, you don't change, from air to water. And I know in our in our neighborhood, we supported the very strict sewer use bylaw, and mainly because of the biosolids programs that we wanted. But it also means keeping our lake clean and our drinking water clean. So I think that the strict sewer use bylaw and maybe ChemTrack need to be reviewed all the time by somebody to see where we could head next, because the sectors sort of have been there for quite a while, and maybe we need to add more sectors or more chemicals or different products so that we continue to make progress on cleaning our air and our water. Thank you.
Thank you very much, Karen, appreciate it. No questions? Okay, we'll take it into committee. Questions to staff? Seeing none. Speakers, Councillor Doucette.
Thank you much. I actually have two motions. The first one is to request the medical I'll get there in a minute, the medical officer of health to report back in 2016 on the implementation of the point-of-sale program, requiring all dry cleaners to clearly disclose to customers the type of solvents used to clean garments and any known hazards these solvents pose to the public health. That's the first one, and I will speak to it in a second. And then the other one, as we heard, is that right now in the Toronto Water is looking at PERC in the water, but if people are changing to another chemical, we should be looking to test those chemicals as well. So the first one, I do agree, we need when customer walks into a store, the same as when we walk into a restaurant or when we walk into a tattoo parlor, we know they've been inspected, we know that they've passed the grade, or they haven't, but they will pass the grade. I think this is a good idea. I don't get too many clothes dry cleaned because I do clean a lot of them at home, whether it's spot cleaning or what, and I don't use any chemicals in my house at all. I haven't for about 6 or 7 years, and that's just how I am. Better for my health, better for my children's health. But I do agree, when you do walk into a dry cleaner, not the one I particularly use, but you walk in and this wall of fumes hits you. I can't actually walk through a grocery store where they sell laundry detergent. I can't do it because it smells so bad. Because that chemical is in that fabric. You take it home, you hang it in your closet. It just spreads throughout your house. And then we put on these clothes. What do those chemicals do to us? So I know I'm talking about dry cleaning more than the other areas, because I want to thank T and all the groups who are here today, because I think it was a good idea. If PERC is being used by one particular industry, how can we help that industry make everything safer for their workers, for themselves, and for their customers? So as I say, basically the two motions go hand in hand. One, to let customers know what is being used on their garments, and two, to make sure that we're looking at, because not all the industry is moving away from PERC, as they do, what other chemicals are they beginning to use? And even if it's not such a bad, harsh chemical, can we steer them away from any chemical? And one way for us to see that is by what goes into our water. So when everyone gets to complete water base, that'd be brilliant, because we won't have any chemicals there. But we've got to get ourselves there bit by bit. I appreciate that changing your machinery can be a big expense. And I do agree that we should probably have someone who helps us with that. As we heard today, a lot of the little industries are little home businesses. So if we want them to move away from the chemicals, we have to help them to move away from the chemicals. So hopefully the next time we see this report, we'll be working on a different industry. So we'll go one at a time, working with the industry though. I don't want to come out and slam any of the industries. I don't want anyone to go out of business. I want us to help them by educating them as to how they can improve their business, help their workers stay healthier. Healthy workers work better anyway. And next time, as I say, we'll come through another industry. So thank you for this report. I was going to ask about crematoriums and concrete manufacturers, but we'll leave that for another day. Everyone's saying thank goodness. We'll leave that for another day. Maybe those two will be in the next report. Thank you.
Thank you very much, Councillor Doucette. Even with the advice, given that Councillor Doucette has just put it on the table, I will move that we request the Ontario Ministry of Environment and Climate Change to institute an incentive program. It's not our order of government, but really it is meant to get them to engage the question, and even if it's small dollars, anything to kind of speed up the process, I think would be valued. It gives our last deputant some extra business, I suppose, but it really is. It's meant to engage them and to recognize that all businesses, especially the small mom and pop shops, they might have a difficulty doing it right away, and it strengthens their ability to do it more quickly. So that's the purpose of that motion. Anybody else? Okay, Councillor Doucette's motions. Do we need to split them out, or do we need to split any of them out? Okay, all of them, the package as a whole? Yes? Okay, all in favor? Opposed, if any? That's carried. Folks, that is the whole item as amended. Sorry, item as amended then, all in favor? Opposed, if any? That's carried. Okay, thank you very much, folks. Appreciate your helpful input. 12.6, introduction and enactment of bills. We have one deputant, Christopher Cardozo.
I think he was here for the other item that's left.
The other items? Okay, he's held four items. So now I do have to ask Christopher Cardozo, okay, seeing that he's not here. So this is the bills governing our procedural bylaw that we gave notice of last month, and now we're passing them. So these are the motions. I'm guided by the clerk here. That bill number 1, prepared for the meeting of the board, to be held on May 30th, 2016, be passed and declared as a bylaw. All in favor? Opposed, if any? That's carried. The other one's up. Bill number 2, prepared for the meeting, be passed and declared as a bylaw. All in favor? Opposed, if any? That's carried. You happy? Okay, great. Okay, number 7. Toronto Public Health Operating Budget Variance for 3 months ending March 31st, 2016. Christopher Cardozo, no deputant. Anybody to speak? Moved by Councillor Burnside. Get his name in the minutes. Get him in there before he leaves. Received for information. All in favor? Opposed, if any? That's carried. 12.8, Capital Budget Variance Report. Christopher Cardozo, not here. Moved by Peter Wong. All in favor? Opposed, if any? That's carried. Last but not least, the 12.9, service agreements awarded and executed by the Medical Officer of Health. He awards and executes agreements. He has to report on them on an annual basis. That's what this does. Christopher Cardozo, deputant, not here. Moved by Stacy Berry. All in favor. Opposed, if any, that's carried. Motion to adjourn. Nice try, Mavic. Oh, yes, one final motion, that the Board of Health excuse the absence of Elisa Levy from the May 30th Board of Health meeting. All in favor? Opposed, if any, that's carried. Thank you very much. It was a pleasant meeting.
You're playing?